Yeah, that's true. That's true. But yeah, I mean, like, I have so many unlisted videos, hundreds.
Yeah, exactly.
Videos.
Yeah.
No one's watching. They're just sitting there.
Just hanging out. Okay. So we're going post ROM or post posture SARS or SARS.
Yeah.
Okay. So that completes the postural anthro stuff. So now we're going to start looking at control-based testing.
Mm-hmm.
So this assessment that we're doing now is called SARS, stands for System Action Reaction Screen.
Mm-hmm.
So it's essentially looking at how your body responds to force. So positionally, and then also we're kind of assessing how your system anchors when you respond to perturbation.
Yeah.
I'll give you a demo, kind of a feeling. Have you ever had any positional testing done on you other than what I was doing yarn on your hand?
Yeah.
Okay.
Yeah, a little bit.
So I'm trying to generate or keep the same force production through your joint, through your whole body. So it's not strength-based testing. It's definitely control-based testing.
Mm-hmm.
It should be like ballpark 5 pounds of force. If we start getting with it and like it feels good to push more, we can do that. But basically, I'm not looking at if you can beat me. I'm looking at if you can match me.
Yeah.
So, and we're looking specifically at the reaction time or the response time to me testing you and us testing your joint. So my cadence stays very similar every single time I do a test. I say, I'm going to pull you this way, you stay that way, ready, go. And then we do the thing.
Mm-hmm.
Cool? Okay, so I'm going to have you stay here. You're going to be pulling towards you. I'm going to be pulling towards me. Ready, go. Ready, go. Ready, go. Ready, go. Okay, let's try the other side. And then we kind of deem, from a conversation standpoint, whether it was high quality or low quality, which is like, yeah, that test felt really solid. You didn't change position. You were able to respond. You felt the right tissue firing. You didn't have a pain response. All of those things we're taking into consideration here. I'm going to pull you towards me. You're going to resist me. Ready, go. Ready, go. Ready, go. Okay, interesting. I just want to make sure we're on the same page here. You are definitely allowed to pull and like fight me a little bit too.
Oh.
Yeah. So let's do that. Yeah, you're going that way. So I'm going to try and pull you this way. You're going that way. Don't let me move you. Ready, go. Ready, go. Ready, go. Ready, go. Are you squeezing your hand? Yeah, just try and do it. Yeah, just kind of focus on the elbow joint. Ready, go. That's interesting.
Yeah.
He's got some delay there.
Yeah.
Okay. Same thing here. Ready, go. Yeah, go chin up. Like a little more chin up-y. A little more. Is that okay there?
Mm-hmm.
Ready, go. Yeah,
There it is.
It's capital flexions. Well, okay, so make a note there. So, Trev, when you're in capital flexion, that's short-circuiting some communication from your neck down to your arms.
Mm-hmm.
And that's giving us a delay feedback loop, so you're not able to respond to me on the dot when I ask you to contract there. Yeah, just make that in notes. So we're already on to something with there's some. It might just be positional from the table, but make a note for a cervical effect screen. See, just write CES there. Okay. Okay, sweet. So that was a demo. Well, we just got a ton of data from that.
Yeah.
That was pretty freaking cool. That was me just showing you that.
We're like, what's going on here?
Yeah,
Okay.
that wasn't even part of the SARS test right there. So the first one of the SARS tests is hip abduction, and I'm trying to push you into hip adduction. Okay. So same kind of deal we just did with the arm there. I'm gonna push you that way. You're gonna respond to me going left. Ready, go. Good, high quality. How'd that feel to you, Trev? Good. Same thing here. I'm gonna push you to the left. You're gonna push to the right. Ready, go. Low quality. How'd that feel to you? Low quality.
Quality.
Try one more time. Ready, go. Okay, low quality. Okay. And then the next one we're gonna do is rotation in, and then kind of this like oblique axis going up and out. So I'll show you kind of where that is.
You're
this
pushing.
motion. I'm gonna push you
Okay.
down and in. Yeah. So rotate in, lift up and out. So that's kind of the position you're gonna be in there if that feels comfortable to you. Okay. Ready, go. Rest. Yeah, we'll do that again. Rotate in, lift up and out. Ready, go. Okay, rest. Okay, low quality there. Trev, you feel that too?
Yeah.
Okay. Lift up and out. Ready, go. Yeah. High quality there. How'd that feel to you?
Better.
Better than this side? Yeah, we'll do this side again too. Lift up and out. Ready, go. You're starting to find that a little more quaddy than TFL, but rotate in, lift up and out. Ready, go. Does that feel better to you in general, this side? Feels
It's hard to say. They feel different.
Yeah, for
I
sure.
can't say that
Better
it
or
feels necessarily
worse?
better.
Cool.
Yeah.
Okay. Go one more time, rotate.
If anything, it gets closer to crampy.
But the right
TFL.
crampy?
Yeah.
Like,
I mean,
are you feeling any TFL on this side at all?
No,
Yeah.
really. Yeah.
So that's what I'm saying. It feels like you're finding the right tissue over here.
Yeah, exactly.
Over here, it feels like you're using rec, like
Yeah.
rec fem.
Yeah. That's what it feels like to me.
Try this just for the fun of it. Twist in, and then hold up and out.
There you go.
Yeah.
Yeah, that's it.
So he's having trouble finding that though. So let's mark that low quality just because that was consistently harder to find. Okay, now we're gonna go straight arms down to your sides, palms facing down, and then this is kind of like a latty, extendy shoulder test. So I'm gonna try and pull you up. You're just gonna try and stay glued down to the floor.
Okay.
Ready, go. Good. How'd that feel? High quality. Left side. Same thing here. Ready, go. Ready, go. Ready, go. Try that. Yeah. Ready, go. Okay. So just a smidge of a low quality there. Nice little pop. Ready, go. Yeah, there it is. It's still giving a. Does that feel a little more givey than the other side there?
For sure. Yeah. And that's why I'm in my right shoulder
Yeah,
extension.
it's just the thing. One more time here. Ready, go. Ready, go. Ready, go. Go chin up again. I'm just curious if this is impacting you. Stay down. Ready, go. Does that feel like you can produce more force there? A little bit. Again, crampy. Tricep.
Cramp tricep.
Yeah. Ready, go.
Yeah.
That feels better too.
Yeah.
Dude, that's close to a bilateral low quality.
Well, both, okay.
But like not quite. Did this right feel more junky?
Mm-hmm. Yeah.
Yeah, and just write IMP with W/cap extension or CAPEXT. Just bang that out. Yeah, so this is that shorthand stuff is going to be huge for you to get down. So like what I'll just write here is that's that Drake thing, right? That Drake. No. Yes, thing. Yeah. Okay. Let's keep rolling, just because I think.
So just to go back over the hip abduction,
Yep.
I think I might have got that messed up. What was it? Right.
Right side was low
Right,
quality,
was low.
Yeah.
and then hip flexion abduction,
Left
left side. Yep.
Okay. Good.
And then bilateral. I mean, it's really close, man. Like initially, it felt like both were. It felt like the left was better,
Yeah.
so you could almost like dash that and circle it, but then both felt significant. Trevor, I'm gonna throw this through. How you feeling laying on the table, dude? You good still? Okay. How you doing on time, man?
I'm good.
Okay. All right, I'm gonna have you flip on your stomach. We're gonna look at hip extension. We'll keep going just because I think
Yeah.
his system is
Yeah.
good. Okay. We're gonna go straight leg and lift up to the
Like
ceiling.
locked up, like really locked
No,
up.
not hammer lock, just kind of like a straight-ish leg,
Okay.
and then lift up like you're doing hip extension. Keep the leg up. Ready, go. All good there, no problem?
Yep.
Same here. Ready, go. Good. How'd that feel?
Yeah. Good.
So.
Yeah.
Let's try that one more time here.
Yeah.
Ready, go. It feels it's holding, but there's some comp patterning happening over there.
Yeah. I like feel how like something's happening here when I do that.
I agree. Yeah, so right
Left.
yeah, let's like do a teeny circle. And then circle PX. And then right below PX, right SI. Is that kind of where you're feeling that?
Yep. Exactly.
And then just throw an R on that on the SI, and then write CM PVA right. Cool. because we're getting dropped out there. Lift this one up again. Oh, there's a little, come back down, and then do this one. Yeah, you can see
Yeah,
how
like-
much more, yeah. So everything's kind of sinking there.
Mhm.
Okay.
Yep.
Okay, sweet.
how it feels.
And then I'm gonna have you flip on your back. Get some air in here. And how's your body feeling?
Good.
Okay. Any stiffening or any junk at all? No. Okay, cool. Okay, so we're gonna do a pelvic approximation assessment now. So I'm gonna have you go arms crossed. You're gonna go leg up. Yeah, whichever one you want to do. I know, right?
Like, which one feels
Yeah.
better?
And then we're gonna go leg lifted up, and then kind of like that, whatever figure four or
Oh.
yeah.
Yeah.
What do you call that? Figure four?
Yeah, figure
Yeah,
four,
and then
I
we're
think.
gonna go there with the figure four. Cool. Okay, so what you're gonna do is approximate your lower half. Keep the upper half still, and you're just gonna spin. Yeah, let me show you here. You're gonna spin the whole pelvis towards me, like kind of
Oh.
pushing the knee towards me and everything, like you're doing like a low back stretch kind of deal.
Okay.
Yeah, how's that feel?
Good.
All good?
Yeah.
Okay, we're just gonna test position here. I'm gonna try and push you that way. Ready, go. Ready, go. Ready, go. Yeah, it's not good now. Okay. And then switch sides. And then spin the other way. Ready, go. Ready, go. Ready, go. Starting to get it. Ready, go. Yeah. Let's go low quality there too.
Mhm.
Okay. That definitely is bilateral low quality.
Yeah.
So what we do with the SARS is if we find a bilateral low quality, we stop this part of the assessment and keep moving on.
Mm.
Any pain?
No.
Yeah. Okay. That's crazy. Okay, so we're gonna go pre-ROM. So now we're moving into pre-range of motion assessment. So we're gonna look at the connecting joints, kind of the capacity of the connector joint, because when we look at the full joint, we want to be able to rely on this as a clean piece of data.
Mhm.
So like for example, if you can't extend your knee here, if
Mhm.
we're doing a straight leg hip flexion assessment,
Yeah.
that's gonna skew data. Let's calculate allostatic load now too. Maybe we can just do this quick and ask him as we go here.
Yeah.
Okay. Number of medications 0.
Mhm.
Trev. Number of injuries. We can go to the health history questionnaire for that, unless you can
I mean,
spout it off.
like, what do you like in reference to like my whole life?
Yeah.
Oh,
Cumulative.
I mean,
1,
location
2,
wise, like what, 4, 5?
Yeah. So
But-
we're all the way there.
Yeah. Amount.
Yeah, more
We'd be
than
talking about-
6 injuries.
Yeah. How
cumulatively.
many dislocations?
Yeah, exactly. Surgeries 1.
1.
Okay. No disease. Number of subjective complaints. SI. Torso
Yeah.
translation, right shoulder or
Yeah.
torso-y thing. We'll
Yeah.
got 3 there.
Mhm.
So it's a 3. Emotional stressors. We got 1, 2.
Mhm.
Age questionnaire. 3, 4, 5, 6, 7, 8. 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21. Okay, and then he's a dude.
Mhm.
He's got a good waist to hip. He's got no edema. He's probably gonna know how to pelvic approximate after I finish this questionnaire. He's like, where is that shit? Let me find that. So that's an anchoring issue. That's a perfect example of an anchoring issue, I think, in your body
Okay.
versus a mover issue.
Yeah.
Yeah.
Yep. That makes sense.
Body habit is good. Specimen. So we got low quality 1, and then we got no, sorta, and then no. So he got let's see, he got 1 cleared. Did he get 1 cleared? Hip extension was kind of clear, except for the he didn't get any of those. Shoulder, no. Hip extension, no. Trunk rotation, no. Okay. 1 pain in QMAMC. Would you say that SI sensation was unwanted on the right side when you did that left hip extension?
No.
It wasn't like a significant thing. It was just like a.
No, I was perceptive that something changed there.
Got you.
But
Not
there
a
was
pain
no
response.
actual. No, yeah,
Cool.
yeah.
Okay, perfect. And then no sense that you have to extend 3, 3, 4, 3, 6, 7, 8, 14, 15, 16, 17, 18, 19, 20, 21, 22, and 21 for 43. Okay. So what we're looking at with this allostatic load is just kind of like your cumulative systemic load over the span of your lifetime. So it's looking at all these factors that kind of give us a current stress state in your body, which helps us to decide how much stress we want to put on your body.
Yeah.
Basically. And so it's cool, like with this program, they've given, it's kind of like a guideline-y recommendation of how much range of motion assessing to do when you do the assessment, so you don't blow somebody up and like totally thrash their system. So you're at a 43, which puts you at a, oh, where are you at? 43 is like a 5-ish, so we can, a 5, perform active full body range of motion assessment if desired. So we're free to move about the cabin, we can do whatever we want with it pretty much, which is sweet. Nope, it's never going well. There we go. Nice. Okay, cool. So we're good to go. We're gonna go pre-ROM now. Perfect. Let's see. What were we just? Did we just film? Okay, we're just starting here, so this is cool. So we're just going into pre-ROM. So I'm gonna have you do this like thoracic-y, cervically extendy thing. Like you're just like kind of going up. Like chin up, chest up.
Like you actually try and lift?
Yeah, and chin up too. Yeah, cool. How'd that feel?
Good.
Okay, come back down. No problem there. Oh, stole pen. Stole.
So clear on cervical thoracic extension.
Yep.
Cool.
And then is it knee extension?
Yep.
Okay. Straighten your knee. And then rest. Can you do that without lifting your leg? Cool. How'd that feel?
Good.
Cool. The same thing here. How'd that feel?
Good.
Do this one again. All good?
Yeah.
Okay. They feel a little different? Minimal?
Oh, to me?
Yeah.
But,
this one feels weirder?
Yeah. I've had some like patellar tendonitis like symptoms there that come and go.
I didn't feel it there.
I've never
but
made any adjustments.
Yeah.
No.
Okay. Just circle left and right CM HIP FLX.
On the notes.
Yeah.
One more time on those numbers, those others.
CM. Oh no, it's already there. Sorry.
I see.
Yeah, you see that black CM comp motion there. So just check that and then write HIP FLX. Is there any zoom? Can you zoom in?
Yeah,
there?
it's,
Oh yeah, there you go, dude. Yeah, that's gonna be easy. Like when you, yeah, and then just write G. Or good. Sorry. No. I'm sorry. I'll do this in order. Don't worry about the degree, and then just write good there. Yeah, perfect. Okay. And then the next one is
just so I can write that better. What was that?
hip flex, HIP,
Gotcha.
and then like next to it FLX.
Okay. Yeah. So knee, straight knee, hip flexion.
Okay, so I'm gonna have you go straight leg, and then you're
Like
gonna
locked out again?
Yeah, like not super locked, but just kind of a
Straight.
neutral lock. Yep, and then lift up to the ceiling as far as you feel comfortable. Cool. Come on back down. How'd that feel?
Good.
Same here. Do I feel better?
A little bit.
Let's try the other side again. Yep. Oh shit. No, it feels good too. Huh? That was good. Yeah, it's good.
Clear.
I did notice he's got a little pelvic drop on that right side that's a little more significant.
Yeah.
Go again there. Ooh, that was better. Are you anchoring with your left leg? Try that again.
Just so try to just kind of do it.
Just with your with your right
without-
leg.
without-
Just curious.
Like if I do it like really without thinking,
Yeah.
that's how I would do it.
Yeah, if you brace
Just
up.
even like a tiny bit of bracing, I can.
Are you
like,
doing that with
control
your
for.
left leg though?
Not necessarily. 'Cause I can lift that left leg.
Yeah. Okay. Cool.
Yeah.
Okay.
Knee flex.
Cool. And then bend your knee. Bring it back down. Bend your knee. Bring it back down. Good. Yep. This is fine.
Okay.
Tibial rotation.
Yep.
Bend the knee to right here. Go foot off the gas a bit, or dorsal flex, and point the foot left. Yep. And then point it right. Oh yeah. Oh yeah. Same here. Point it left, and then point it the other way. And then again, and back. Does that feel a little stiffer going right into internal rotation there, comparatively to the other side?
No, my perception is my right.
Weird.
feels- Do I have less?
Let's come back. Try that again. So that's a lot of ankle inversion. Come back.
Oh, okay. I see what you're saying.
I'm not seeing any tibial rotation or very minimal internal.
Okay.
Let's try this side again just
That's
to get a
interesting.
comparison.
Yeah.
Come back. Go again. Come back. So I'll just give you that tactile feel of this.
Yeah.
Rotate in.
Yeah.
Come back. Rotate in. Come back. Let's try the other side again. Rotate in. Come back. Rotate in. Come back. Rotate in. Come
Interesting.
back. Let me see if I can passively. I'm not
Yeah.
gonna. Feels blocked, almost jammed.
Mm-hmm.
Nice.
That's
I like that. I was not aware of that.
Yeah. So let's go left. We'll call it a P. And just in the notes, go jam question mark.
okay.
Because I don't know, I can't tell if it's end range already, and that's why. Or if it's like, it might be the reason why he's perceiving it as good, just
Yeah.
because he's already there.
Right.
Okay. No pain there, everything was good.
External's all fine.
Yeah, his external was money. It was great.
Cool. Elbow extension.
Cool, he's good.
Elbow flexion.
Bend your elbows. Cool, good.
Okay.
GH.
Yep.
Okay. So we're gonna go elbow bent to 90. And then
Oh
we'll
wait, no, sorry.
Oops.
Are you?
Oh yeah. So go palm facing you, palm facing away. Come back down here. Go palm facing up, palm facing down. Does that feel a little sticky on the palm down?
Yeah. Yeah.
Let's go.
I guess I'm just like I've never really thought about it, so I don't even. I
Yeah.
don't know what normal would feel
Yeah.
like.
Go palm up. Go palm down. Both a little sticky.
Mm-hmm.
Just end range, eat rest. That's available pronation there.
Yeah, and I don't have it.
Yeah, go for it. Yeah, you see how much wrist you're trying to do there to,
Yeah.
to move the elbow joint there?
Yeah.
Yeah, let's go bilateral pronation, and let's just go fair.
And that's a. I had.
Yeah, just out of curiosity, let's just play with this again. Go chin up, and then try that pronation. It's about the same. Does that feel
Yeah.
any different to you?
No.
Sensationally? Yeah, no. Yeah. Yeah. So.
Okay. Supination was clear.
Yeah, look good, supination.
Cool.
And
Now
then,
GH.
yeah, that's good. And then let me hold on. Let me check this elbow. Go palm facing you, palm facing away. It's kind of a. It looks like it's a flexed and extended thing.
Mhm.
Like he's trying to. And then right CM hand. He's doing some weird stuff with his hand when he does that.
Okay.
Like you're taking over a lot of the rotary component in the like wrist, finger, hand
Mhm.
flexies,
Yeah.
extendy stuff. I can't even tell what you're doing there, but it's something
No,
it's like alien thing going
Yeah.
on. Okay. Spirit fingers.
So now GH abduction.
Cool. Okay, so you got elbow flexed and extended there,
Elbow
circled.
flex.
Yeah. There you go.
Gotcha.
Cool, and then supination was clear bilaterally. Good. Yep.
Mhm.
Okay. So we're gonna abduct this shoulder to 90 degrees, and come back.
We're at low. We're at low battery here. 10%.
Nice. And go again. Cool. And back. This is why I charged this thing today, because I was like, we're gonna be burning this phone out. Nice. Okay. How'd that feel? Good. No problem.
Yeah.
And then let's go out to the side here. It's a little different. Go again there.
Yeah, I mean, my
He-
perception of it is
Oh,
very
it's crazy. Rest. Go again. So he's extending his arm. So this is GH abduction 90.
Yep.
And he's go again. Like extending his elbow and flexing his GH.
You want me to write that in the notes? Or
Yeah,
write-
just CM, compensatory motion. You can just write GH, FLX, and then ELB, EXT. Well, let's give that an F. Not an F is in fail, but an F is in fair.
Yep, that was right.
Because it wasn't that bad. Okay, now we're gonna go overhead flexion. Go straight up, palm facing this way. Yeah, good. And then we're just gonna go backwards. Make a note on the right side, some crepitus.
Okay.
Or you can just write CREP.
I want to ask you about this.
Ooh, that felt better. What'd you do? You engage your serratus?
A little bit, yeah. Yeah, I mean, last time I was thinking more.
Just send it.
Yeah, just say it. But yeah, if I'm more like
Intentional
intentional
about your
about how I
fitness.
do it. Yeah. Yeah.
And CM ABD. Yeah, you don't want to get close there, huh?
Nope.
You don't want to close that collarbone out.
Not at all.
Okay. He.
That's right side.
Yeah, we're getting into the nitty gritties here. I mean, this is technically we're not even looking like this is what I'm looking at with pre-ROM is can you get to here,
Mhm.
but we're already in the stuff, and that's great. And then how about that abduction-y thing though?
Yeah.
It's fine.
Fine.
Yeah. So the left is great. Let's go F on the right. Cool.
Sweet.
Okay. Next is the full range of motion assessment.
All right, let's
So here we go. So we're getting kind of like what we just did with the. Well, I guess we've done this kind of completely already, but like we're getting into the weeds now. Like we're gonna be like getting into like nitty gritties of sensations and what
Sweet.
feels with. So I'll be asking you all these same questions here. Eli, how are you doing, man? You good?
I'm
you,
good
you
till
chilling?
I've got something at 1, so
Cool, dude.
yeah.
We're great. Okay, Trev, how you doing? Good, good. Okay. Let's go legs down. We're gonna start with. Ooh, let's see. Can you scoot back a little bit just so your hips aren't totally loaded? Yeah. Does that feel okay? Okay. Rotation internal. Is that what the first thing is?
Extended full internal rotation.
Yeah. Okay. So we're gonna rest here. Okay. Rotate in and come back. How'd that feel? Good. Rotate in. Come back. Do both. Come back. Do this one more time. And then come back. And then do this one. Feel pretty good to me. How about you? This
Yeah.
one feels a little more different, but
Yep.
range wise, this doesn't feel significant.
Cool.
Yeah.
You agree?
Yeah.
Okay.
External.
Straight leg external rotation. So externally rotate. And come back. And go again. Cool. And then same here. Okay. Does that feel like a little more stoppy
Yep.
over here?
Yep.
Okay, so let's go right side internal 3, left side external 3.
Well, like I can make a pelvic adjustment
Yeah.
to where I
It's
clear out my
easier to
left-
do.
Yeah.
That's
if, I'm,
why.
if I'm just going for
That's
the
all I
laps,
want. I don't want you to do anything
Cool. From a relaxed
intentional.
state.
Yeah.
Yeah.
Yeah,
So
because
is-
what? Go for it. Sorry, dude.
I was just say you should. So I'm not clearing internal rotation.
Nope.
So
No.
Right.
Yeah, if I just saw
Okay.
that right internal,
Okay.
it was minimal. But
Okay.
now that I'm seeing a comparative,
gotcha.
let's
Okay.
write them down.
Anything else
So-
about motion or anything like that?
No, it just feels a little.
Okay.
You could actually write in the notes just like a little blocky.
For the external.
Both.
Oh, okay.
Yeah, and then you can tick that yellow box too. So that's showing some pelvic stuff there.
Okay.
That's why I was like, okay, as soon as I see that, that's like you just said.
Yep.
That's pelvic. This
Yep.
is pelvic.
Exactly.
It's not a hip issue.
Okay.
It's a pelvis issue. Try going this way. Does that feel super great?
Mm-hmm.
And then this way, fine.
Yeah.
But like just a little blocky.
Yeah.
Yeah. Okay. So that's confirmed. Okay.
So are we doing just thread stuff, or are we doing?
I might cherry pick some stuff. Let's see, knee flex 90, hip flex. Yeah, we'll take that because I want to see what the pelvic. So this is a perfect example of like we can do whatever we want to do, maybe not necessarily. Maybe I won't look at his digits. Like that's not something we need to look at today. But I'm actually kind of curious about his right hand, so we might look at that too. But like with this one specifically, now that this sparked my curiosity on pelvic position, now we're gonna look at that 90 or that hip flex position to see if he's getting blocked out on one side or the other, right? So let's go up, bend the knee, and then we're gonna come knee to the chest slowly. Cool. How's that feel?
Good.
Same thing over here. So I feel like an end range, just a little sticky.
Close. Yeah.
Yeah, and he's extra, or he's abducting. Okay, so let's go.
Right.
Yeah, like a right 2,
Yeah.
CM abduction, ABD. Makes sense. If your pelvis is rotated left, I just want to see what happens here. Try that same motion. Does that feel different?
Yeah.
Does it feel smoother? It still seems like you want to abduct a
I
little
definitely
bit.
want to abduct
Yeah.
and
Like,
rotate.
Does that not feel good?
Yeah, not so good.
Okay. Pain?
No,
Just
run out of room.
blocky.
Yeah.
Okay.
Cool. Knee extended full hip abduction. Abduction.
Cool. Okay, go legs down. And then we're going to go straight-ish leg. And then abduct your leg on the table out towards me. Feel how you just lifted it off the table there?
Say that again.
Okay. So go straight leg
Yeah.
on the table.
On the
and-
table.
And abduction.
You want me to actually just go?
Yeah, I'm just cruising with you.
Oh.
Just feeling
Oh,
the
I see what you're
motion.
saying.
Yeah, I'm sorry.
Alright.
There you go. Yep, come back. And then try and look for just straight abduction without any rotation there. Cool. Come back. Yes. How'd that feel?
Good.
One more time there. Yeah, that's all good. Okay, cool. This one is like a couple times. We've got to learn what I'm asking for.
Yeah, for sure.
Same here. And come back.
No difference.
Yeah. Go again. You do some weird stuff at end range there.
It's like floating up.
Yeah.
Yeah.
To the side again. Yeah, they're way different. I don't know, man.
Way different.
Yeah, it's crazy. It's just like it's weird. Like the way you're getting there is so much different. Let me check that again. I just want to feel what your pelvis is doing. I mean, right there it starts feeling tight, but it's kind of weird because that feels like controlled end range.
Mm-hmm.
Like it feels like you have more control out here.
Mm-hmm.
This is the problem with having so much available range. Is it gets like it gets weird out here in the. Oh yeah, you're way more free there. Like your pelvis is even moving better there. Let's give it a.
Oh, good. Oh, adjustment. Right?
Ooh, I felt that pop.
Felt that?
Yeah.
Yeah.
Let's go right. 2, good. And then some weird pelvic. I call it a pelvic shift.
Yeah.
Like it's weird because it's not hip hike and it's not rotary and it's not.
That's why I have
it's
such a hard
this
time working
weird,
on this
it's
stuff
this
on
weird
myself.
thing. Yeah,
'cause
yeah.
I can't put
Oh,
words
bro,
around
there's
them.
no. It's a different motion. Let me
Yeah.
check that one more time. I just want to feel that. And we did get the pop, so we might feel something different. No, go again.
Sure.
Yeah, it's like a hip hike and translate or and rotate PVA right thing. Like you're kind of pinning up here a little
Yeah,
bit.
yeah.
I can
That's
feel
my
that.
perception of it.
But then there's also this rotary component too that's happening.
Yeah.
And then we're gonna go ADD.
Sorry. Let's see. Yep, ADD.
Okay. So I'm gonna have you go. You okay here? Yeah. Go straight-ish leg, and then bring this one towards this one. Cool. Come back. How'd that feel?
Good.
Same thing here. Okay. Come back. Do this one again. I feel better.
Yeah.
Do this one again.
Yeah, you're catching it.
Yeah. Okay. It doesn't look bad. Let's give him a good. Let's give it a 2. Let's give it it kind of looks like he's getting blocked out. Kind of like let's just write left blocky. That's that hip hike left thing.
Put hip hike.
You could write HHL question mark. Stuck. It's just that's so many weird words, man. It's just like spewy kind of like stuff that makes sense to me.
Knee extended full talar crucial dorsal
Deflex. Okay. Go off the dorsiflexion here. Well, reset that. Rest. Was that just you getting ready to go? You did something weird with your pelvis there.
Oh, yeah.
That wasn't like response to this.
No.
Okay. Go again there. I just wasn't sure if you were like. I was like, all right, bro, that's gonna be something we're gonna write down if that wasn't intentional.
No, honestly, do you want to know what it really was?
Yeah, I do want to know.
You said dorsiflexion, and like every time I hear dorsiflexion, I'm like, which one is it again? Yeah.
Oh yeah.
I swear, I talk about this stuff all the time. For some reason, dorsey and plantar.
You're like,
it's like every time I go, which one?
Like upside down? What's going
Yeah,
on?
yeah.
Well, and then you're on a table too. So
Well, exactly.
makes
Like
them
I
more
think of
jacked up.
dorsiflexion always as planted on the fixed to the ground.
Right, so you're dorsiflexion.
Exactly,
Bound.
yeah.
That's funny. Which actually, if you're doing that, you have to maintain like isometric tension in plantar flexion to counterbalance the
Yep.
dorsiflexion
Exactly.
component. So
Yeah.
I can see it. Dorsiflex here, and rest. Go again. Rest. Go here. Rest. Go again. Rest. Go again. That's close. This feels a little more sticky, man,
Yep.
but it's not much.
No, you're
Go
right.
again here. Rest. Go again here. It's a little sticky. Let's go dorsiflexion 3, right?
Mhm.
And then nothing weird going on there. I'm just gonna check available range here. Yeah, he's got
I got
way more available range there.
Blocked to the right. Yeah.
What's that?
Did you say?
Dude, you got way more range than
Yeah.
you're presenting there.
Oh yeah.
Yeah.
Does he have more on the right side in general?
Yeah, it feels like it almost. Yeah.
I was just gonna say it looks like he does. Yeah.
No, it feels pretty similar.
Okay.
He might have a little more here.
All right.
Um,
Plantar.
yeah,
Or
I'm
do you
gonna,
want
I'm gonna check locked calcaneus too.
You're gonna rate that block calcaneus?
No. I'm just looking at locked just to see if there's any differences. Oh, he just popped my shoulder.
Oh,
good.
Good on you, dude.
Yeah, he's having a bad time with that locked inverted ankle. Cairo there.
Good on me.
Yeah. With that inverted or locked calcaneus, there should be a little place where you can circle that. Right under locked, just write 1 and then do a big star next to it. And then maybe highlight it too. Because that thing is totally blocked out when we're inverted. Yeah, he's fine in eversion. Okay,
Cool.
Plantar flexion.
Mhm.
Point the foot. Rest. Point the foot. Rest. Point both feet. Rest. Good. There's a little blocky on the right too. Go again there. Point the foot. Rest. Point the foot. Rest. Do both. We're pretty close. How do they feel to you?
Yeah, they feel
Pretty close,
similar
yeah.
in
Clear?
plantar, yeah.
Yeah. I'd say they're clear there.
Cool.
Okay, and then I'm gonna go. I am gonna do his full foot analysis here or
Okay.
foot assessment.
All these.
Yeah. You just want to rattle them off.
Ankle plantar flexed, forefoot everted, subtop.
Gotcha. Yeah. Okay, so right's and then check passive here.
Okay.
Passive box.
Gotcha.
You see where it is. Let's go right 1.
Okay.
And yeah, nothing else there.
Okay. So then
And then I'll keep cruising here, man.
you got it.
Let's go left. Let's go left inversion or ADD 3.
Okay. So that was the same one you just did. You just did right.
Let's see.
ADD.
Right ABD
Oh, ADD.
1, left ADD.
Wait, you have that reversed, I think. Told me 8.
So we're going. That one is. That's left. I'm sorry. So that's an L3. Yeah. Nice. And then. Yeah.
Cool.
Perfect. Right one. ABD. Yeah. Nice. Perfect. And then first phalangeal flexion.
Yep.
Those feel fine.
Cool.
And then extension.
Yep.
Those feel fine.
Sweet.
Those feel good to you.
Phalangeal, first phalangeal abduction. EB.
Left. 2.
Okay.
Ooh. Yeah. 1.
That's the same. Yeah.
Cool. Anything else to say about that? No.
Nothing else to say
Second to
about that.
fifth. Phalangeal flexion.
Feel good. How they feel?
Yeah.
There's
Okay.
like a little something here, but that's not. I don't
Thanks.
think that's from your toes. I think that's from your forefoot.
Yeah.
Let's see.
Same.
Extension's great. No problem.
Cool. First metatarsal head dorsiflexion.
Make this easier on my life.
Yeah.
This is usually about how long it takes me to figure that out.
Yeah.
Like
Yeah, around here.
30 minutes into the range of motion assessment.
That's good for you.
What's that?
Getting down, man.
Oh yeah.
Down that squat.
Yeah, but I'm getting into this business here. I can get close to your foot. This is what I love about this job, man. Is like, or career, or whatever you want to call it. Is like we're moving differently. I'm never, in other than planning
Right.
files. I'm like doing shit on people's bodies all the time. I'm like showing people exercise and. I'm trying to figure out what the hell's going on here though. It's like this hip position thing is messing with everything. His right hip is actually more externally rotated on the right side than I thought it was.
Mm-hmm.
Dude, it's okay. So it's a left dorsiflexion 2. Yeah. 1. Yeah.
Cool. Plantar, when you're ready.
You know what, man? Crosses out. I'm not feeling anything. It's coming from somewhere else. Yeah.
Okay.
Yeah. No. So just clear that one off.
Yep.
Yeah. Plantar flexion.
Mm-hmm.
That feels a little stickier.
Mm-hmm.
You too? You feel that? Minimal. Minimal.
Yeah.
No. Let's
Clear.
not go there. Yeah. Clear.
Cool. Done with that.
Okay.
Alright, now hip flex 90, knee full flexion.
Okay. I think we already did that one, I'm pretty sure. Let's go back to that pre-ROM. Knee flex. Straight knee, hip flexion. Ooh, that that was clear. Straight knee, hip flex. All right, let's check it again. So go straight leg and lift. Yeah, just keep that leg
these ones?
straight. Yep, lift up again. Come back. Yeah, go just a teeny bit slower. Come back down. Yeah, with this one, brace your core or whatever you need to do.
Okay.
Yeah, go for it.
Oh, sorry, I went too fast.
Yeah, that's good. Come back down. Go again. There it is, right there. Okay, cool. Okay, come back down. What'd you do differently that time that secured your pelvis? Do you lift your head up?
Did I?
Dude. Because when I was filming that before, essentially your pelvis is collapsing like immediately when you start lifting your leg up.
Oh, yeah. It's hard for me to perceive on the table.
Go
but-
for it here.
Okay, so you want me to try to prevent that, or?
Yeah, because it's like a.
Yeah.
So you lift your head, which is interesting.
Oh, I don't think I did.
Oh, cool. Okay, check. Yeah, do that again. Yeah, so it's at about, it's like 85, 90 degrees that he starts comping there, and then go here. Same. Okay, those are clear. Cool.
So you go back down. So you're back down.
Yeah, just clear that one out. It's the same. It lines up the same as what we saw before too.
Okay.
That's great.
All right, and then knee extended, full hip flexion.
Wait, what did we just do?
Oh wait, we just hip flex 90 degrees, full knee flexion.
That's the next one.
Well, that was the one we were supposed to. Just
Oh, I'm sorry. Okay,
So that was
so
the
yeah.
That's why I was
Knee
confused.
Yeah, that was my bad. Yeah.
Okay, cool.
Okay, so we're gonna.
So now we're doing that one?
Yeah, and then go heel to the butt. Cool. And go again. Cool. How'd that feel?
Fine.
Okay, same here.
I always feel like I'm missing range of motion here, but
Yeah.
it's not too bad. I think it's improved.
That feels pretty damn good, man. Comparatively, there's a little tendon pop on the right side, just in the notes, right?
Oh, yeah.
Tendon pop on the right lateral knee.
No, that's not-
Cool. But otherwise clear.
Yeah.
Cool.
Yep.
Are we going over any of the just go to red stuff? Or?
Oh, is this an opportunity to look at tibial rotation? Like knee flex 90, tibial internal?
Hip flex 90, tibial internal.
Yeah, let me check that. I just want to see what that looks like on his
Yeah.
lat. So we'll look at those. Go leg down here, and then go foot off the gas slightly, or dorsiflex, and then point the foot left. And then pull the heel to the butt slow. Cool. How'd that feel?
Good.
And then go external. Same thing. That was feeling really good there. How'd that feel?
Good.
Same here. Let's go slight foot off the gas. Yep. And then go. And then pull the heel to the butt. Ooh.
Yeah.
There it is.
That's it.
Okay, come back. Point the foot left. Same thing here. All good? Yeah, so it is showing something.
Internal, left, internal.
Yep. And let's give that a 2. I mean, he's getting the range, but it's just hard for him to access it.
Yeah. It took like a sec
Like
for me
mental-
to like ramp up. Yeah.
Does it feel blocky or hard to access it? Like, does it feel like you're running into a wall, or is it like tissue that's not kicking on?
It seemed more like the latter.
That's
It
what
did-
I thought too.
Yeah, it didn't
I
feel
agree.
like it was complete block.
I agree. Go again in, and then pull.
Yeah, it felt like it was hard for my brain to make
It's like,
sense of.
where is my medial hamstring
Yep.
stuff? Yeah, it actually feels like you're trying to like hammer your gastroc.
Yep.
Yeah. Okay. Cool.
Anything to note on that?
We could just write like lack of hamstring engagement. Medial. Dude, this is gonna be so nice having all this data. You're gonna have bro, you're gonna have a blueprint for your body,
I
man.
know, huh? It's nuts, man.
And
We haven't
then,
even gotten into the shoulder.
and then
We have like another
It's gonna be
hour.
weird, dude.
We have another hour of this. We might not. I don't know.
Team
We might
externals.
not do the
Like
phase 2 stuff today.
tib external is clear.
Yeah.
And then you want to keep going with that. So hip and knee flex to 90 degrees, full hip internal rotation.
Yes, definitely. Okay. So we're gonna go external rotation. And then internal. And external. Awesome. Okay. Same here. External. Nice. And internal. External. Internal. You feeling there? You like a little jammy?
Oh yeah.
Yeah.
Yeah, my right internal is always.
Yeah. Okay. Right internal.
Right
Let's
internal.
give it a 2, and then let's give it a F. And I'd say jam. He's running into his pelvis there.
Yep.
Okay, let's try this side again. Just want to feel what that external feels like. Feels fine, huh?
Yeah, I mean,
It's
I have
like
a
the
little
same,
less.
It's the same thing there.
I have a little less.
Yeah.
Of, yeah.
Yeah,
for sure.
let's go left external 3G. Because it doesn't feel like it's getting blocked the same way that.
No,
Yeah.
because I can. I mean, like.
Yeah, you
The
can.
difference is like I can keep. I have a lot of available
Yeah,
range. I'm just wearing
you're capped out over there.
completely.
Yeah,
It's
so that means that
completely
we're
jammed.
probably dealing with right ASIS drop and approximated
Yeah, that's what.
left.
So you're saying
That's what I-
left was external 3, right was internal 2.
Yeah.
Yeah, cool.
Because he's still moving through the hip. I think it's just the pelvis is blocking him out.
Mm-hmm.
Let me make an audio note there.
Yep.
This is, that's kind of, we found some meat and potatoes there.
Yeah, that seems like.
So when
So
assessing
that's
90-90 hip rotation, when we look at left external rotation, we're feeling like there's a slight block there. But then when we assess, when we look at left external, there's a slight block there. When we look at right internal, I'm feeling like there's compression or blocking from the ASIS kind of dropping into almost like an anterior pelvic tilt, and then also an approximated position, which is kind of running the hip into, or running the femur into the pelvis there. So that could mean that we're dealing with more. Yeah, that lines up with that right rib cage compression and then posterior pelvic tilting on the right side there. So it might be more of that, which is causing the torso the pelvic approximation versus a hip height component. Okay, cool.
I'm in the restroom real quick.
Yeah.
Is it cool?
Yeah, of course. I'm gonna eat. This is the time. My body's going, alright, bro. You want an egg?
No, okay. Actually, I can't do eggs. It's not like I don't have like a major allergy.
Oh shit. You like one egg?
No, thank you.
Dude, this is going to be the most comprehensive assessment video ever.
Nice.
I mean, like the dialogue in it is like fun. Yeah. You should, alright?
I've never seen that before.
Oh, dude. Those are sweet. The Mobos?
Yeah.
Brilliant. Have you seen the blackboard? Oh, dude. Alright. The blackboard's like a 4-foot training tool, and the Mobo's a rear foot training tool.
Okay.
It's pretty cool.
I might need to get some of those.
Alright.
hip flex, knee extended, hip external rotation.
Wait, hip flex, knee extended,
Hip flex, knee flexed, hip extended.
external rotation.
Oh, sorry, extended.
There we go. So let's see. That's hip. Oh, that's that's the little pigeony thing. So I'm just gonna have you drop.
right.
Drop that out to the side there. Okay. How'd that feel?
Good.
Okay, and then switch.
So there's that.
Yeah, switch sides there. You feel that too. Go for it. It's just a little more, huh? A little more blocky.
Feels like it drags my pelvis
Yep.
with it a
Yep.
little more.
Let's give it a 3
And I'm fairly aware of like,
tight adductor stuff.
yeah.
Okay.
Cool.
And then right tight adductor.
Pelvic approximation.
Okay. So we're gonna go. You can go arms down for this one. Lift up. Drop the foot here on the thigh. This is gonna be that pelvic twist test again. So,
yeah. Okay.
And then we're just gonna and you can anchor with your upper body this time, and we're just
Okay.
gonna see how much range you got here. Yeah, that feels great. Rest. Nice. Come back. How'd that feel?
Good.
Go. Switch sides then. Go for it. Yeah, you're getting stuck. Okay. Or not getting there. Come back. Let's just play with this for a second.
Yeah.
Can you compress these ribs here? Rest. Rest for a second then. Can you just do the right side? Rest. Just do the left. See if you can do that over here. Okay. Now approximate. Does that feel better? Does it feel about the same to you?
It feels more like
Active.
muscular.
Yeah.
Yeah.
Yep.
Whereas it felt like really like I was running like a block, like
Yeah.
a passive block.
Yeah. Go again. Like tissue wall now,
Yeah.
right?
Yeah,
Control
exactly.
wall versus bone wall.
Yeah.
Yeah.
It feels like if I feels like if I were to work on that, I could make progress.
I
Whereas
agree.
the other way is just like,
Dude,
nah.
super easy way to do this. Go back up there. Go hand here, that, and then like working through that part of the palm, compressing here, and then approximating. So it's almost like you're trying to like drive side bend and approximation. Yep, and then miling into more range as you feel like it develops. And it's kind of hip flexy, adducty too, not hip extendy driving through the heel there. That would be the other. That would be the other key.
Yep. I
component
feel
there.
that difference.
Yep. Yeah, so we're not trying to torque that way. It's more closey, like closing joint angle. That right there. Yeah. Yeah, there.
Yeah.
Oh, we just did some treatment. All right. We're
Yeah.
making note that we just did that.
Yeah.
That's gonna.
Well, that's what. So like,
might skew some data.
yeah, I know, right?
Oh, like approximation just in the notes here.
Yeah, just write like TX PVA R.
Just right.
Yeah.
X.
PVA R.
Yeah.
What were
I
you
basically like
You're
I'm
doing that?
I'm doing that fairly regularly, but
Okay.
not with this setup. And I think this setup is the best.
Yeah.
Like,
Because I did see you were hip extending.
Yeah,
comp
exactly.
With that left leg.
yep.
And then just highlight that so we don't miss that. Yeah, nice. And you are emphasizing the rib pack when you do that too?
Yeah.
Okay.
Yeah.
So should we do that as just put right and then was there any number or should I clear it?
No. Let's do a 1 there. That's huge. And then a big star on the yellow there. Yeah. That's big time.
Sweet.
Okay. Okay, cool man. Is your back feeling okay after doing that?
Oh yeah.
Okay.
I feel great.
Oh good. Nice.
Do you want to go on to this is a black one, a hip knee flex to 90 degrees, full knee extension.
Yeah, let's check it, because it's left knee. Let's go up. And then, and then we're gonna go up to 90. And then just straighten the knee. Animal. What a fucking specimen. No hamstring tightness at all. Let's go. Same here. A little tight over there. And that's no big deal. It's all good. Yeah.
Yeah, I mean, like
I just felt something weird happen there. That was interesting. Go again.
Didn't you say you felt the tendon?
Yeah, I felt it again. Come back down.
Yeah.
Go up. Go down. Go up. Yeah, it's clear. It's fine.
Cool.
It was like the first time, and then it didn't do it again.
Oh, really? Yeah.
So
I was feeling it too. What were we doing when I was feeling it?
It was
I can't remember.
knee flexion.
Yeah.
Just straight knee flexion.
Yeah.
next one's knee extended full lateral spinal flexion.
Cool.
Trunk side bending.
Is this hip hike or is this?
No, knee extended full lateral spinal flexion, trunk side bending. It's not one of the red stuff. It's
Okay, so this is not the one below that,
Yeah.
which is hip hike,
Yeah.
lateral lumbar. Okay, cool. Let's go legs down, arms down, and then you're just gonna like slide, reach, kind of lateral flexion, side bend your spine. Cool. Yeah, is it like a shirt?
Yeah.
Like a shirt would be better to do this.
I would slide. Yeah.
Yeah, let's do that. I got it right. Yep. Yep.
Might be backwards.
Is that gonna mess with you? Going backwards? Yeah, it's gonna mess with me, dude.
Did I just say that out loud?
Is that gonna mess with you? Fucking neurotic, dude. Shit's gotten weird in my old age, dude. Come back, nice. Looks great. And then, same here. Okay, come back. Do that left side again. You just get there easier. Come
Yeah.
back. Go this way. Quality of the motion's the same. It just looks like there's more effort getting there.
Yeah. Oh yeah.
And
then
you
at end
translate
range,
too. Go for it. Sorry, what were you gonna say?
I was saying at end range, I definitely feel like crampy.
Like tissue crampy?
Yeah.
Cool.
Yeah.
Okay.
so
Yeah,
right.
Let's give that a G. A 1 because I think that's the same system. Star that yellow box there, and then you could just check the pain box, and then write cramp. Either in the box or wherever you want to write that. I know it wasn't pain. We're just using the pain box as unwanted sensation. We should
Yeah.
change that actually. Change the letters on there to US, not PX.
Yeah. Cool. Okay, so now it's
Hip hike.
yeah.
Okay. So now you're gonna keep your upper body still.
Mm-hmm.
You okay there?
Mhm.
And then I'm gonna have you hike your left hip up, and then come back, and then hike your right hip up. Oh, that's weird. Okay, so here's a CM hip flex, right? Do this way again. Okay, come back, and then do this way. Oh yeah, he's not moving. Okay, and then also
So right.
it's actually like lateral T-spine extension,
Yeah.
like T-spiney
On this is the right.
on the right side, yeah. So check. Let's just for funsies. Let's try this. Compress here. Rest. Dude, can you do that compression without respiration? Rest. Do this side. Okay. Rest. Let me see if I can cue you on this differently. Can you, instead of doing like an oblique compression, rest, can you do more of a sagittal compression? Like rest. Yeah, let me show you what I mean here.
Yeah.
Try and push my fingers out of your rib cage system. That.
Mm-hmm.
So let's see if you can rest. Let's see if you can do that over here. See how it wants to go oblique.
I'm not even aware of that.
I know.
Like, I have
So
no.
check. So let me show you what I mean here again.
Mm-hmm.
That.
Mm-hmm.
So it's almost like you're trying to bring these 2 points. So I think what you've been working on a lot is only the diagonal or oblique
Yep.
component.
Yep.
You're really good at this, but what I'm thinking is happening here is this diagonal tissue is pulling, but what's happening is we're missing this like almost like transverse abdominis activation,
Yep.
which is gonna pull this up with it.
Love it.
Rest.
Okay.
So like the idea would almost be like to bring these 2 points, that right there, hold that. That sensation right there.
Mapping it.
Yep. Let's make a note there that we did that as a treatment too. That's a crazy feeling, huh?
Oh man, it's yeah.
Like
'Cause
life
all of a
force-y?
sudden,
Yep.
just if I hold that, just breathing, I'm very aware that of my SI joint area, but it's a good feeling.
It's
It
like
feels
an
like it's
expansive
like
feeling.
yeah, it feels like
Yeah.
things are actually opening in the way I want.
I love that.
So what do I write for the treatment?
We're just gonna write education on rib cage compression in sagittal plane with posterior pelvic tilt right. Yeah, that was it right there.
I think here's my problem actually now that I think about it. I know I've done this
Yeah,
always accompanied with flexion. I think I need to
work on this.
in extension. Yeah, because I work on this prone or
Okay.
like quadruped.
Where you're doing you're doing something like on your stomach, like doing like a pull in motion.
potentially,
Yeah.
or in quadruped.
Yep.
But I think I'm always like looking.
Look to see.
I just
to, like, get
realized
the
I
feedback
never.
loop.
Yeah,
Yep.
I think I need to work on it because immediately doing it here it feels differently with just lying on my back.
So we could drive systematicity here, Trev. So what you could do is flex your head up, look at it, find that motion, like find that kind of thing, yeah, and then keep it as you come back.
Do you think that's good right there?
Yeah, that's good there. And then keep it as you come back. So that'll simplify the grooving pattern. Or should, at least. Was it easy to maintain it as you got down?
Yeah. Yeah, it feels good. I think even just retraining even respiration, because immediately when I go to breathe in, I want
You want to go back to
wanna-
yeah. That's why I think what we need to do is figure out some positional respiratory training to do as well. Man, we could grind for a couple months on this shit, dude.
yeah.
Was there a number on this you wanted, or the right?
Yeah, let's go 1. I'm actually gonna leave it out here too.
Yep.
Just to get that down. I'm doing 11:20. Yes, we're doing good. Okay. When assessing hip hike, observation of kind of jamming, thoracic extendy, side bendy action. When training, rib cage compression, observation of oblique, lateral to medial, superior to inferior compression of the rib cage, re-education on sagittal plane rib cage activation with posterior pelvic tilting of the ASIS. The conversation was the practice has been done cervically flexed, not in extension. Potentially some merit behind training plyometric flexion to extension with the sagittal rib cage compression and posterior pelvic tilt. Okay, cool. Okay, sweet.
Yeah.
And on to upper extremity.
Nice. There we go. Oh, shit. That's gonna be good on the video there. I was just gonna hold.
Do a break.
No. Let's see if this magnet's oh, okay. No way. No way. It's not possible. That's crazy. I can't believe that's holding it. Okay. Whatever, let's do it from over here. That's gonna go down at some point. There's no, yeah.
Shoulder.
Whatever. That'll work. That's lame. Thought I was all prepared with the charging box. But it's too heavy. You got me? Oh wait, I have a cord. What am I doing, dude? Oh yeah. Oh, that's that cord. That's fine. We got 30%.
Yeah.
Is that what you were gonna do? Was grab your? Oh, that thing. Oh
I'm
no.
gonna show you how to get us angled down.
Oh, dude, I don't know what I was thinking. This is. Cannot use accessory. Too much power.
Too much power?
What are you talking about, friend? Charging. There we go. Nice. All right. Good to go. Damn. Okay, shoulder.
Shoulder.
Let's go, dude. I knew this was gonna be a 5-hour assessment.
Yeah.
Humorous
I
adduction.
knew it, dude. I was like, yeah, it'll be about 3.5. I was like, yeah, that's fine, all right. Wait, what is it?
Humerus adducted elbow full extended. Shoulder girdle depression.
Okay, we're doing shoulder protraction, retraction, depression. Okay, or shoulder protraction, upward rotation, downward. Okay, I'm gonna have you go. Bring that arm down just for. Yeah. Bring the shoulder up to your ear, and rest. Down to the foot. Rest. Down to the foot. Rest. Up to the ear. Rest. Okay. Down to the foot. Yeah, rest. Up to the ear. Rest. Okay, go down to the foot. Okay, that feels horrible. Let's go. Let's go. I mean, not horrible. I'm sorry. That was great.
That was right.
It's like just tilting, right?
Yeah,
When you're trying to
it's
depress.
like there's no. Yeah, so it's
right depression.
Yeah, let's give it a 1. Start the thing. Give it a P. Not pain. I'm sorry, P.
Oh, I see.
Yeah, and then comp motion is just straight protraction, basically.
Yeah. It's like I can do that, but it takes like
You have to like
I
get
gotta
all
lock
of
some
in your
stuff in.
brain.
Yeah,
Yeah,
exactly.
Yeah, and then do this one again. Yeah, that's and rest. Oh, I know what you're doing. Your arm's sticky, or it's like sticking to the table, huh? Relax here. I got you. Go down. Yeah, that's better.
Yeah.
Okay, that feels more true to me. I was like, what the hell's going on there? Yeah, rest. This thing is bugging out though. I can already feel it like going, I don't want to do it. Okay, go down. Yeah, it's like GH flexion.
A little bit.
It's like 3 inches of flexion right there. Come back up. Go again. Yeah. Good. Yeah.
Cool.
So that's big.
Is elevation clear on both sides?
No. Let me check that again. Go up to the ear. And rest. I'm gonna check it again with the non-table loaded stuff. Yeah. And go. That one feels a little more blocky.
Yeah.
Let's go left 2. I don't know where the comp pattern's coming from, but it's kind of weird. Let's see. I think we had
Well,
right.
I think
Yeah, I
it's
was
my
gonna
neck.
say that lateral flexion of the
Exactly.
neck.
I think I just if I open I can.
Yeah,
clear
so
more space.
let's say jam. So on that left side, just write jam, and then write LAT, FLX, serve, L. Cool. Nice. Right, I know. So, thinking all that.
Learning, dude.
I know. So there might be this might be a kind of a key lesion system.
Yeah.
Here, this rib pack. I mean, we can play with it. So compress here, that kind of rest. I do more of that sagittal. That, yeah. And then come back down with your head. Yeah, see that puts your head, your neck that way. Shrug up here. Yeah, that's cleaner. You feel how that's cleaner?
Oh yeah.
So yeah, this is a key system. That right rib cage compression is huge for that lateral upward the upward rotation of that left shoulder. Let me see if that's the same for this downward rotation. That'd be freaking nuts. Yeah, you got the compression there?
I feel like I need feedback.
Yeah. Got you. Yeah, there you go. Good. And then downwardly rotate. Yeah, he still has no idea what he's doing there.
Whoa, hold on.
I'm sorry, depressed.
You said okay.
Yeah,
yeah.
sorry, that was why.
I was like, wait, what are we doing?
Depressed there.
Hold on.
Yeah.
Look at that. You feel like that's good?
Yeah, that feels pretty good. And then come back. Let me get you there. Yeah, you still get down there?
I think so.
Okay, go for it. It's different. It's very different. Go again. There's still a little bit of yeah, there's still some stuff. I think that this is a real thing there. It feels better, but it feels
It
like
still
this
doesn't
is
feel
still-
good.
No.
I'm still aware that it's
That
uncoordinated.
felt like that pretty much cleared all that nonsense over there.
Yep.
Yeah.
I agree.
Okay. Let me leave an audio note there. Okay, when exploring upper rotation or elevation depression of the scapula, observation was right rib cage compression, sagittal plane clears, mobility issue left shoulder, going into upper rotation by, it appears by pulling the cervical spine out of lateral flexion left. That frees up that jamming sensation in the shoulder when exploring downward rotation on that right side, unchanged as far as mechanical changes go with range of motion improvement. Okay, cool. Okay, and then we have protraction.
Yeah.
Okay. Cool. You out of this again.
Yeah, relax.
The nice thing is we can rely on this to go back to normal.
It affects my T-spine so much too when I do it.
Like positionally, it's changing where you're.
Yeah. Like
Yeah,
I just got some cracking in my
Dude,
T-spine
it's
just
a
from
trip.
doing this and breathing.
I can feel, not feel but I can sense body energy changing.
Yeah.
Like your body's like almost booting up when you get that thing.
Yeah.
Like it's like.
Yeah. I mean, I
body
feel it
looks like it's
because
like
I've worked on
eating
this.
that. Yeah.
I've worked on this enough
Yeah.
where like some days, if I really get it
Yeah.
online, everything feels
Yeah.
better.
Like you were saying.
I feel light.
Yeah, I think the biggest thing, like you were saying earlier, is influencing respiration with that system.
Mm-hmm.
So I think that's going to be the big breakthrough.
Okay.
Like what we can do, or what this
100%.
process can do for you,
Yeah.
is changing the respiration component. So
Sweet. That's
yeah.
what I need.
Yeah. We're gonna go protraction. So go forward. Rest. Yeah, you can just noodle this out and just protract. Yeah, good. Rest. No problem there. I feel easy. And then same here. Yeah, all good.
Yeah.
It's good.
Yeah, clear.
Cool. Full internal rotation.
Okay. Spin your GH internally. Okay. How'd that feel?
Without any shoulder blade?
Yeah, I mean ideally. Yeah. Yeah. I mean,
It gets gummy.
Yeah.
It doesn't feel
Do
great.
this one. Yeah. Okay. Go again. Yeah. It's like
Moves.
Yeah.
I,
it's a lot better.
Right.
It's and then
Yeah.
externally rotate. Yeah. Let's give that right internal a 1, and then external here. And then let's give that right external a 2.
yeah. I feel great.
And he's not comping, but he would if he could, if we weren't aware of the lockdown. But we don't. I mean, you know how to not comp with that. There's some stuff that's been interesting, like you haven't been aware of the comp, or like it's been hard to counter the comp, like in the hip.
Oh yeah.
There's a
for
couple
sure.
things that were interesting there.
Oh yeah. Yeah, no doubt.
like you were saying, you're like less aware of some of this stuff. Like you're more focused on the
Yep.
shoulder, right?
Yeah.
Yeah.
Did you want to do the other non-red stuff here?
Yeah. Let's check it, man. I mean,
So, GH internal rotation
90.
90-90.
I'm gonna get you there.
Do it.
You okay there?
Yeah.
And then we're gonna internally rotate slow. Yeah. Okay. Come on up. Go again. Okay. That's about it. Yeah.
Yeah.
And then external. Good. Go again. Yeah, nice. Go again.
This is where
Nice.
I feel cautious. Like I can
Yeah.
go further,
Yeah,
but
I'm just stopping you.
yeah.
I don't want you to go any further than that.
Exactly. Yeah.
Yeah, you about there is where I don't want to go anymore with you.
Yeah. Whereas on my left, I feel
Yeah,
like
you just all day. Let me check
yeah, but
this
it's so
insert.
funny because like if I'm doing it on my own volition,
Yeah.
I feel more comfortable. When the second someone else grabs me, I'm like, yo,
Ooh,
like don't.
you want me to? You want to try it on your own? Like, but do you mind if I maintain your shoulder?
Yeah. If you
Come back. Do you mind if I move you a bit just to test this like true GH?
what does it feel like to you?
It feels like you're driving supination to try and. Yeah, there you go.
Yeah, that feels like
Yeah, and then do that internal again.
Internal's fine. You that didn't.
Okay,
Yeah.
yeah, okay, okay.
That
Let's go
doesn't
again.
that doesn't bother me at all. It's just external rotation is where you dislocate.
Yeah, okay.
So like
That's where you're like going.
yeah. I feel my whole nervous system go.
Just like tense up.
Yeah.
Yeah, it's funny, even though I'm like trying to keep you safe going there, your
Yeah,
brain's
yeah.
like, no, he's not. He's
Don't
gonna
trust it.
Are you like thinking that people would do that? Is your body
Potentially,
probably-
yeah.
I'm the opposite. I'm like,
Yeah. I
you're
know,
gonna
right?
go less, dude.
Yeah.
Like, yeah, because I could feel this that your SC kind of like almost
Exactly.
like external or
Yeah, starting to get closer
upwardly.
to
Yeah.
stuff.
Okay, externally rotate. Yeah. Okay. And then internal. Okay. That's interesting. Do that again. Come back. Try that rib cage compression.
Fucking look at it.
That. Nice. In there. Yeah. Come back. Do that again. There's more stuff there when that's anchored. Do you feel that?
Yeah.
Okay. That's interesting. So his internal rotation at 90 degrees actually looks pretty similar.
Yeah.
And then external rotation, I'd star that. So let's go. Shit, sorry, I should have said
Yours,
this to
yeah,
you.
your
Yeah, so the
Internal.
both internal. Let's star that. Oh, I'm sorry, this one here, not that one. Yeah, nice, yep. And then internal seemed fine, tick that box. Actually, well, shit, man, this is kind of interesting. I'd say his left felt a little bit more limited than his right there, so let's go left 3. And then just IMP with right pack, right ribcage pack. Dude, the other way I would mess with this is by like palpating. Do you ever do any kind of palpation stuff
yeah.
all the time? Like I'd go rest for a second. I'd go like this is gonna feel fucking. Do you ever get under your rib cage?
Mhm. Yeah, I get in mine.
Up in there.
Yeah, up in that.
Okay. With all that.
Yeah. So you think that's helpful?
Yeah. Yeah, from a tactile stimulus standpoint.
Okay.
Yeah, because your brain's going. There's an awareness here.
Okay, I see what you're saying.
Because it's the TVA. I'm not super up on MAT stuff, but I'll do this not their process of like test, retest. Look, it's all of a sudden your spindle fibers are telling your whole body what's what. But from a stimulus standpoint,
That's intense.
so I'd go all the way down into your pubis
Yeah.
because that's where that TVA is running into.
Yeah, for sure. Okay.
I'm like all the way to the pubic crest there, and then I'd hit all that ligamentous stuff all the way up, and then even like into the ligamentous or tendinous, whatever, tendinous attachments of the abdominals too.
Yep.
All that. See if you can find that easier. Yeah. A little bit.
Yeah, I think so. There it is.
Yeah, I'd be smashing on that stuff.
Yeah.
Or I'd like, what I like to do sometimes is like contract it and then also poke on it while I'm contracting it. Like if you contract it and then, oh dude, you're sunk there. That's crazy. Let me see. Oh, okay. I'm gonna contract this. Like that stuff.
Yeah.
Like contracting it and poking on it. Like that. Like that stuff right there. Because that's just giving you like direct feed.
Okay.
Yeah, your brain's going, oh yeah, that's lighting up.
Do you think accompanying some lateral flexion here is helpful?
I think I'm not sure yet. I don't want to. I don't
Yeah,
know. I don't know. I want to look at the mobility profile before,
Okay.
because it's weird. It's a weird thing. It seems like you're not bad at laterally flexing. It looks more anterior. So I think we're gonna find out more when we look at you seated.
Yeah. Yeah, I agree.
Okay.
I think weird stuff comes out when I'm seated.
Yeah.
Yeah.
Because your spine's loaded.
Yeah.
Yep. Okay.
So let's see here. I think we where we left off.
Fucking rabbit hole, dude. Humerus adducted 90, elbow 90, full GH external rotation, right one. Yeah, let's go right one. And then just right cautious on the right side there, because that was definitely, his body responded kind of weird there. And then let's see, this is humerus flex fully internally rotated, full horizontal adduction. Humerus flex 90, full internal rotation, full horizontal adduction. Okay, so we're gonna go out to the side here. Yeah, we're gonna go here, and then we're gonna bring the elbow into your side. Just kind of slide it in.
Oh, this way. Okay.
Yeah.
Yeah.
Yeah, I'll let you do that on your own. Sorry to block you out there. Is that sticky or from the table, or is that just hard to do?
No, it's hard to do. It's hard
Okay.
to do. Yeah.
Yeah, and then come back here. Yeah, and then go again. That's harder to do. Come back up. Go again. That's even harder to do, huh?
Yeah, for sure.
Yeah, let's let's do circle both of those, and then on the right side do a 1, and on the left side do a 3. And then on here, just make a note, no SC MVMNT.
no, SC V
MV,
M.
sorry, MVMNT. MVMNT. Yeah. Let me see this one again. Go for it. Yeah, go that way. And then come back up. And then go again. Just a little bit. Go again. A teeny bit. Okay. Yeah, it's a little bit. These are both hard to do.
Yeah.
Yeah, for sure. Okay.
Okay. Do you want to go on to full GH and shoulder abduction?
Yes. Yep. AD abduction. GH flex 90.
GH flex 90. Yeah.
Yep. Okay. And then we're gonna go adducted. And then come back. And then go again. And then come back. Go again. Okay, cool. How'd that go?
Fine.
Like medium.
Yeah. Yeah.
And then same here. Upward rotation. And then try and monitor that. Go for it.
Yeah.
Yeah, you're liking that. Okay.
Yeah.
Right one.
Yeah.
Comp motion, upward rotation.
Upward rotation.
Yeah. It's actually weird. He's not. Let me see the side again. Go for it. Go cross body. Yeah, you're all good.
That's right.
Is that the wrong one? I'm sorry. Did I do the wrong one there, dude? Humerus abducted 90, elbow 90, full GHE. Wait, we just did that, right? Shit, where are we at here?
I thought we were. That's what I thought you were.
Oh wait, hold on. Okay. No.
So you might get a little screwed up.
Yeah. So okay, so we got humerus flex 90, full internally rotated, full horizontal 8. Okay. So this one is.
What you just did. Just
Yep, and then we're gonna go right 1.
What was this? What was this one?
Let me check this out here. Hold on. Shit. Let's see. Humerus flex 90, full internal rotation.
That was the.
Okay, and then we had humerus abducted 90, elbow 90, full GHIR. Then we had humerus 90, elbow 90, full GHER. Right. Humerus abducted 90, elbow GH, full ER, full shoulder adduction. Okay, that was the one.
That's
Left,
it.
and then 1, and then
Right 3.
right 3. There it is. 1.
One.
Yeah, there it is. Okay. Sorry, man. That was
That's okay.
There we go. And then,
This is the one you just did.
Yep, and then that's
Gotcha.
gonna be a 1, and then star, and then right,
Hmm.
and then fair, nose extended, full external rotation. And then 90 external rotation. Oh, there we go. Okay, nice. We're there. Okay, fully adducted, and then we got this one. Humerus fully adducted, full shoulder girdle overhead flexion. We know we already assessed this one, right? We're gonna give it a 2. Fair, and then compensation. A, B, B, C, just to make sure, but I think that was what it was. Shoulder fully flexed, abducted, full shoulder girdle elevation. So shoulder fully flexed, abducted, and shoulder girdle elevation. So you're gonna go, yeah, and then keep going, reach. Yeah, good. How'd that feel?
That's fine.
Yeah, reach. Ooh, yeah,
Yeah.
that would be tasty.
Yeah.
How'd that feel?
It actually doesn't feel bad.
That looked like nice.
Yeah.
Do you do that very often?
Well, so I think what happens
You get
is
warmed up.
I think I compensate with more upward rotation on my right side. So I think my like I can take myself into upward rotation, but the glenohumeral doesn't necessarily have that range. It's like all coming from
Scat. Got you.
Yeah.
Yeah, it's weird. So
Because I've done so much overhead, I think I've trained myself to do
Gotcha.
that.
Can I guide? Can I go with you here?
Yeah.
Okay. I'm not going to actively move you. I'm just going to let you do your
Oh,
thing.
okay.
But I want you to try and supinate, and then go. And then come back. How'd that feel? Fine.
Yeah.
Cool. I was just noticing you were comping with pronation or protraction, pronation there.
Mm-hmm.
Go again. It's getting blocked out here.
That's
I
what it
think.
feels like.
Yeah,
Yeah.
it's weird. You're almost like too upwardly rotated, dude.
That's my perception
Yeah,
of it. Yeah.
perfect. And let's go here, same thing. Yeah, that's exactly what it is. You're actually running into your cervical spine.
Yeah.
Let's just try. I'm just curious. Push into me here, and then go. And supinate a little bit there. Keep pushing. Keep pushing here.
I don't like it.
Yeah. Does that hurt?
No.
Just hard.
Yeah, I feel like I got nothing.
Yeah, okay. So let's make a note there because I think there might be a plyometric overhead flexion issue. When observing overhead flexion, right, noticing that the SC joint's kind of running, the collarbone's running into the cervical spine, it appears that we're overly upwardly rotated and there may be some plyometric control from downward rotation to upward rotation when going overhead. You say you need to be sort of 1?
Probably like an athlete for like 12, 15.
Okay. got somewhere deep to go.
I got some things to do. But I think
Beforehand, yeah. Well, this has been pretty informative.
Yeah, it's really helpful. I'm getting better also. This
Yeah, I do. This is great. Okay, so that was, we can do that. Right hand side, shoulder roll abduction, elevation, 2 cm, GH, flexion. There. Okay, then we have full external rotation, 30 degrees, full shoulder overhead flexion. Okay, so we're gonna go palm up, and then we're gonna go up this way and just keep going, keep going, keep going, as far as you wanna go. Cool, good, come back, nice. How'd that feel? Good. Same thing here, we'll start down here, just to see how that initial movement goes. Yep, go for it. Yeah, so you feel yourself wanting to externally rotate there?
Yep.
Okay, so let's go a 1 comp ER.
I just corrected my
The rib?
rib.
Yeah,
Is
it
it-
opened it up.
Yeah.
Let me-
Did you
let me
feel
check
that?
it.
Like,
I did, yeah. Yeah, it's way different.
yeah.
Dude, let's check that same thing, that kind of like abductee, reachy. Oh, sorry, I smashed on your skin, dude. My bad, you're gonna have some red marks there.
Oh yeah.
Still. Oh,
Yeah. It's like
feels less jammy in the.
yeah. It's more like I was losing it here, and then I would have to like think about it, and get it back,
Get it
and then
back.
go a little further.
Okay, that's
But
yeah.
it'd be like this. I wasn't able to get here.
No,
But
I feel like you
this
were-
is significantly different.
I can put my finger in there now.
Yeah.
Like that felt like if I went there before, I was running into your neck basically.
You
Okay.
know what? You know what's interesting? It feels like to me. Oh, go ahead. You say what you need to say.
I'm just gonna rip back.
Mhm. Rib pack works for me, works for
Yeah,
Dion, works
it's
for
crazy,
everyone.
man.
Everyone's
Yep.
that rib pack.
It's-
I have a left
The
left
key,
rib pack.
the key is not immediately thinking that that's the key, right. That's not
Yeah.
gonna fix everybody. But if you want to, you test a theory
Yeah.
and you're like, shit, that's real, right?
Yeah.
Which is crazy because with some people, like with Gail,
Yeah.
that wasn't the case.
Yeah.
Like I thought that left rib pack thing would help, and didn't. It's been totally different. Other
Yeah.
stuff that So,
Yeah.
what were you gonna say, though, man? I'm sorry.
Oh no. I was gonna say like the sensation when I get there is it feels like my like lat attachment and teres major
Yeah.
have never opened into
Yeah.
full adduction. Like it's
Yeah.
like whoa, what's that?
Yep.
Yeah.
So that it has something to grab onto and then actually lengthen with, versus what you were saying was like the whole thing was just going together.
Yep.
Like that teres is connected to the scap.
Yep. And
And-
everything's upperly rotated
Right, so
anyways.
the scap's already going, the arm's going, everything's blocked out, versus that scap being able to anchor into some downward rotation and then get that stretch response going. That's cool. Okay. I just wanted to hear that in my brain too. So
Yeah.
out loud, I needed to
Yeah, verbalize it. Yeah.
Yep. What's next?
Elbow fully extended, full RU supination.
Cool. We did these. I think we're clear. Yep.
Pronation as well.
No,
Pronation was-
bilaterally kind of junky.
Yeah.
Although, ooh, that left feels worse now. I'm gonna hop over there. Feel that. No, they feel about the same. They actually weirdly feel better right now than they did earlier. Do you?
Just warming up.
Yeah.
Should I clear them or?
Yeah. No, let's just go. I mean, because it's been there. Let's go 3G. Yeah, I'm just leave it at that. Yep.
Okay, elbow extended, RU fully supinated. So full elbow flexion.
Full elbow flexion. Okay. Go palm facing you. Curl. Cool. How'd that feel? Cool. That's weird. Okay, rest. Little external rotation comp there.
Oh,
Do that
really?
again? Yeah. Now it's an internal rotation comp. Yeah, let me show you what it feels like to not do any movement. So I'll be like kind of the bumper lanes in the bowling alley there. There. How does that feel? Fine?
Good.
Just doing some
Just like this, I don't know what I'm. Yeah.
doing though.
Like I'm not like aware of any.
Yeah, that. I don't know. Let's just give it a 3. I mean, it's not crazy. The range isn't bad. He's just kind of trying to find the place.
I mean, it seems like bicep crampy when
You,
compared to how I would normally want to do it.
yeah,
Yeah. it
like when
seems
you're when you're fully supinated. Yeah,
Yeah,
that makes
yeah.
sense.
Yeah, but even if I try and fully supinate,
But
but internally rotate or something,
Yeah.
I don't feel as
I
much.
think it
But
might
where
be-
you were putting me
yeah, well,
there.
let's
yeah.
give it a 2. It's because you have to maintain external rotation when you do it that way,
Yeah.
which could be helpful.
Yeah.
Because you're going here, which actually pronates you a little bit.
Yeah. Exactly.
Can you maintain supination and internally rotate? Yeah. Sorta. Yeah.
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 Anything else you want to put on that?
Mm-mm.
Going
Pronation.
on pronation.
Okay. Let's check this pronated. Go palm here. Curl.
Curl.
Yep. Okay. And curl. Go again. Sorry. Do this one again. That feels like almost like bony stopping point there.
Oh yeah. I feel that.
There's that one.
Yeah. And I remember having some
Wristy.
Compression.
Oh, maybe that's the wrist extension thing.
maybe I actually had some like compression issues when I was doing jujitsu.
In the
where-
elbow.
Yeah, where like if this would get too compressed, I would get a lot of pain in my elbow.
Okay.
Didn't really happen on my left too much.
Let me check this out real quick. Flex your wrist. And then let's check that out. Yeah, feel how it's softer.
Yeah.
Rest. Go flex again. Gives us more.
Yeah.
Rest.
Yeah.
Go again. I don't feel like I'm getting that wall.
No.
Go extend. It's starting to feel better,
Yeah.
but you want to supinate.
Definitely.
Yeah, let's highlight the supination. Oh, excuse me, pronation, and then highlight yeah.
Nose roll.
Yeah, let me just bang on that really quick. Elbow extended, fully pronated, full elbow flexion, and then we have right to fair jam, and then audio note. When exploring elbow flexion with pronation, observation of hindered range of motion with bias and wrist extension. When driving wrist flexion, it seemed like that cleared up some space for that elbow to complete full flexion. Potentially what we saw earlier, which was a wrist extension, finger extension issue. Okay, cool. Elbow flex 90, radial under neutral, ulnar deviation. Okay, so we'll look at the wrist now. Yeah, we'll clear this. I'm just doing the whole thing, man. Just bang this whole. This is gonna be cool because we'll both be able to process this.
Nice.
So I'll send you this and you can process it too. Okay, we're gonna go ulnar deviation, no problem. Radial deviation, no problem. Wrist flexion. How'd that feel? Wrist extension. Wrist. Try that again. Rest. Do the wrist flexion again. Do the wrist extension. Good. How'd this feel?
Good.
And then we'll go radial deviation. Ulnar deviation. Good, come back, go wrist extension. Come back, go again. Good, comparatively, how do those feel? I feel like you got a little more here.
Yeah, I thought maybe more.
Go flexion here. Feels okay too. Let's check this one in flexion extension again. Go flexion. It's a little blocky there. No?
I mean,
And then go extension. I feel like I'm having to anchor you a little more here, but
yeah.
it doesn't feel bad.
No.
Go this way. Go ulnar deviation again. Then go radial.
I do feel a little blocky.
Yeah, I don't
right
like
there.
that. Yeah. Let's mark
radial.
Yeah, mark radial as let's go a 2.
I think I have to. If when I try to, I have to go extension a little bit.
Or
Yeah. Well, no, like
you don't like
no
that.
flexion,
You
no
don't
flexion,
like that. And you're trying to pronate
Yeah.
out there. Okay. So yeah, let's go again radial. Yeah, it's tweaking out a little bit here. Rest. Try going into extension here. Just extension. And rest. Go again. Okay. I'm wondering. It's weird. It almost feels like you're already in radial deviation.
Really?
Like, it just feels like when I was looking at your wrist extension and flexion, it kind of looked like you were already like set here.
Yeah. That actually makes sense.
It does? Okay.
Yeah.
So you're, I mean, it'd be interesting. Let me bend the elbow real quick. I'm just going to do a quality check here. Stay here. I'm going to, yeah, ready, go. Rest. Stay here. Ready, go. Rest. Try not to go grippy. Try to go wristy. Ready, go. Yeah, both of those feel weird. Okay. Yeah, this is just going to give us a rationale to explore the right wrist. Okay. Let me see where we're at there. Ulnar deviation. Yeah, just check that ulnar deviation box there. Clear. Okay, then we'll look at those guys. Okay. So let's go palm facing you. Flex the wrist. And then extend the wrist.
Gripped or?
No grip, just flex the wrist, yeah. And then extend. Okay, and then we'll go the other way. Extend. And flex. That seems better. Let's go this way again. Flex. Oh, that feels, it's fine, huh? Extend. How does this feel?
Yeah, good.
Do all those feel pretty good? The
I never have any issues
Yeah.
with my wrists.
Okay,
Like,
and then we'll go supinated, flex. And extend.
I do a lot on my hands, and,
And then
I never
come back, and then
encounter
come back.
anything.
Extend. Flex. Okay.
Clear everything?
Yeah, I'd say they're clear. It looks like there's like a little more chunkiness in this one, but that makes sense because he's got this systemic shoulder
Yeah.
downstream thing going on. Do one more here just for the fun of it. Yeah, rest. It's just different. Like the wrist itself is cooperating. Go back. There's just like feels like
Yeah.
gunk.
Yeah. I think so too.
Yeah. Okay. Let's keep going.
Okay, cervical spine, OA joint.
Those are gonna be interesting.
Yeah.
We still want to do all of them?
Let me see where we go here with this.
So let's just start with the red. Cervical floor rotation.
Rotate your head left. Come back. Think about like spinning, almost like sliding your head. Yeah. Nice. Come back. And then go the other way. Come back. I'm gonna give you kind of a guide here. Think about a dowel going through your, yeah. Cool. And then come back. And then again. How's that right feel compared to the left?
It feels like it can go further. I mean,
Okay.
they feel different.
Yeah,
Basically. I
I
think like
agree.
the pattern I use.
Yeah, it's different,
It's
but
different.
it feels like you got adequate range.
Yeah.
Go again, left rotation. Okay, and then go right rotation. Yeah, you got more right. Okay. Let's go, I'm gonna go like left 3G. It felt pretty good to me both ways. It feels like there's other stuff going on downstream that's messing with your neck. Okay, let's go left ear to the left shoulder. Side lateral flexion, cervical.
Of the right.
Cervical.
Yeah, you're going
Yeah.
left. You were touching my right.
Oh shit, I'm sorry.
I was confused.
Yeah,
I was
my
just
bad,
confused
dude.
on which side we're doing.
Yep, cool. That looked good. Come back. Other way. How'd that feel to you?
It feels like
Blocky?
Like, not necessarily blocky. Like I run into some like weird muscular stuff.
Almost like,
Like I can keep going.
Yeah.
It's just
Bindy?
yeah, exactly.
Yeah, come back. The range looks good. Let's do a circle right. 3G, and then let's just tick the red box and write SX. I'm sorry, US. Or you can just write like lateral flexors. He's feeling some stuff there that he doesn't like. Which might be back down to the rib pack thing.
Yeah.
I bet you about 80% of this is gonna get cleared out with that rib pack.
I think so too.
And then you could just write on that on the notes there, rib pack question mark.
Okay.
Cool.
Alright, that's all for red. You want to do anything else?
What else is in there?
Starting at the top, we got full cervical flexion and sagittal deviation right or left.
Yeah, it did.
It did.
Yeah. So the rib pack cleared out the side then. So
Cat fully flexed.
I think a lot of this neck shit is gonna be cleared out by your rib cage, but let's go. Let's just play with it for a second. Lift up, and then rotate left, and then rotate right. Yeah, that stuff feels pretty good. How'd that feel?
Good.
Come back down, and then that was cat flex,
That was cat fully flexed. Yeah.
and then cervical flex, and then cat flex. Okay, so now we're gonna lift the head up, and then tuck the chin, and then rotate, and then rotate. How'd this feel?
Good.
Okay, come back down. Just lift your head up, just whatever you want to do, and then come back down. Yeah, check that top box off too. Yep. What else we got there?
Cervical fully flexed, full cervical rotation.
No cap. Got you.
Yep.
Alright, that's the only time I've ever used that
Yeah.
saying in my life. Rotate, rotate your head right.
Definitely some weirdness to the
Go
left.
left? Yeah, I agree. Okay,
Yeah.
circle that left. Let's give it a, I don't know, what do you think, 2 or 3 for you? It's in between those
I
two
like
for me.
2.
Yeah, 2. Yeah, it feels like it's capital, but I'm not sure what's going on there. Let's check it one again.
It all comes from like a
Yeah, let's try the back, I guess. Let's see what happens there. Just a one-trick pony there. Fuck me, dude. Alright, yeah.
Alright.
Jesus Christ.
Alright, so yeah, that rib cage is a key lesion, man. That thing is blowing his system up.
Ah, yeah.
Okay. Full cervical lateral flexion, cervically fully rotated.
Oh, yeah,
Sorry.
good. No, that's
Reverse.
perfect. Yep, rotate here and lift your head up. All good? Okay, rotate, lift up. Come back
That looks
down.
different.
Yeah, dude. Come back down. Reset that, dude. What? Lift up again. Okay, come back down. Rotate the other way. That looks different. It's way different. Yeah, I'm guarantee that's a ribcage thing again. But left rotated is not good. Is that what you felt too?
It all felt weird. to
It
me.
all felt weird.
Yeah,
Okay.
yeah.
Really?
Or just left.
He's.
I don't even know. I couldn't even perceive the difference. They were so different.
Yeah.
I can't even put words to
Okay.
what it felt like.
What it appeared to me is that he was comping with lateral flexion left as he lifted. So like none of this right tissue as he lifted. Like you feel how your SCM is kicking on here.
Yeah.
Rotate the other way. So come back down and then lift up. See how like your SCM is like you're like smashing capitally here, and this
Yeah.
SCM is like a noodle. So it's almost like you would want like this feeling here, and then lift up. So you're tucking your chin. Yeah, chin
Oh.
up, chin up, chin up, chin up, right there. More chin up, right there. Yeah, and almost like more of this. Chin up,
Oh,
chin
yeah.
up, chin up.
Oh
Chin
god.
up, chin up, chin up, right there.
Oh yeah, that's awful. I feel so bad. I can't believe that.
Yeah, so that,
Oh.
that SCM is definitely, and this could be, you want to try it with the rib pack just to see, did we already do that? I can't remember if we did it or not.
We didn't, but yeah, it makes sense.
Let's just try it. So, right here, come back down. Oh shit, you were just spining the thing, huh? Sorry.
Good.
Good. And then lift. Yeah, you're getting way more SCM there.
Yeah. Yeah.
It's still,
I wonder if like SCM is. Yeah. Yep.
what were you gonna say?
No, just yeah. It feels like it freed up the SCM to actually do something.
Yeah,
Whereas
it's-
like it feels like what's happening is my SCM is like pulling on my clavicle all the time.
Yeah. Yeah, I'd almost wonder if you're. Yeah, no, I think you're right.
I don't
I
know.
agree. Yeah, I was gonna. I was theorizing what would be interesting to do an endurance assessment there because I'm wondering if that SCM is not used to pulling your neck.
Yeah. That's what it feels like.
Yeah.
I feel like I use this SCM to like to breathe.
Yeah. Weird. Yeah. Just try. Let's just do this here on that one. Which one was that?
That was this one.
Yeah. So that would be just write FRQ. SCM.
Let's see.
Yeah. Cervically fully rotated, full capital extension. Okay. Okay. Rotate.
Was
your
there a number for that one left?
Let's give it a 2.
Yeah.
Yeah. And then the motion quality was like fair. It wasn't horrible. It was just kind of weird.
Mhm.
And then and then the comp pattern was cap flex. R. Good.
So yeah.
Yeah.
So cervically fully rotated full cap.
Cool.
Extension.
Rotate left. And then go chin up. Okay. Come back. And then rotate. And then chin up. Let's try that again on the other side. And chin up. How's that feel to you on this side?
Again, it's one of those ones where like I perceive a difference.
I'm not exactly sure what it is.
Yeah. And then do the other one. I just feel like you're not closing that. There it is.
Oh
It's
yeah,
like
there you go.
Yeah, come back.
That feels.
Yeah, go again there. And then like go chin up into my. It's hard to do that. Check this out on the other side. Yeah, go for it.
Oh yeah. Oh yeah. That's very different.
Yeah.
So
Okay.
left.
Yeah, it's like a 1. There isn't really any capital extension going on there, so let's give it a P.
Okay.
I'm sure that's the rib shit.
Okay.
Wait, did you see that?
That's insane, dude.
What the fuck?
Yeah. So yeah, all this. I mean, this is fun doing the neck stuff just because you'll be able to see this on
Yeah.
the video too. But this, I think, all of his neck stuff is related to his rib cage,
Yeah.
pretty much.
Sagittal deviation. Right or left.
Into extension.
Full circle. Full extension.
Okay, I'm gonna have you head off the table. Back this way, like
Oh.
dangle mode. Yeah. And then I'll just kind of keep going a little bit more. Yeah. And then we're just gonna drop the head backwards. Pretty good there, clear. And then we're gonna go rotation and then extension. Is that what it says?
Yep.
Pull the head back. Ooh. Okay. And then go this way. And then go down. And then go this way. And go down. Okay. Let's do that again. That got better that time. Go down. There's something weird going on here. Okay. Left rotation and extension. What did that feel like to you, man?
I feel like I couldn't go anywhere.
Okay.
Like there was like no range of motion.
Let me check something real quick here. You want to scoot? Are you cool just holding your head here for a second? Go again.
Left.
Yeah. Same. That feel about the same to you?
Yeah.
Yeah. And left.
That almost was worse.
Yeah, I agree. Like it felt like stuck.
Yeah.
I'm just seeing if there's any vestibular shit going on.
That feels
It's a little better.
better.
Yeah, make a note there. Right ear cover, slight. It's slight, but there might be something there. It might just be tactile stimulus too. Yeah, let's try that too. I don't think I like that.
That's the only one that really.
Yeah, I agree. Yeah, I don't think that's your rib cage. Come back this way. Yeah, do this one. Are you packed up there?
Pretty well.
Here, packed there.
I feel like
You've
to
got
be
it.
fair, when I start going to cervical extension, I have no reference point. I
Yeah,
feel like I kind of
yeah.
lose it.
And then come down. Yeah, your brain starts freaking out back here, dude. Stay down here. I'm gonna try and push you up. Stay down to the floor. Ready, go. Yeah, I think that's vestibular. Okay, come back down. Yeah, you're good. We can check rotation too. Come backwards. Rotate left. Rotate right. You like right better?
Yeah.
Yeah, okay, come back up. So yeah, left. Both those, you're good to go there, man.
Number on both those?
Left. Let's give that I'm gonna give it
The rotation?
Yeah, both of them. Let's give them ones and star those. I think he's got some vestibular issues going on. And then let's leave an audio note here. Bro, honestly, I could spend 3 months with you.
Yeah.
I wish we got to this earlier, man.
Oh, I know.
Dang it. Okay, so when assessing cervical extension with rotation and rotation with cervical extension, I'm seeing some interesting ocular patterning stuff going on where his eyes are kind of trying to guide and stay right. Also, with auditory or with ear covering right, we did see slight improvement, maybe a vestibular issue going on there. Okay. You gotta get out of here, man.
It's okay. I just need to make a phone call and I can stay for that 15.
Okay.
If you want to
You wanna do that?
hold down.
Yeah, I can just keep
Yeah.
cruise. Well, let's see. Dude, we're getting close.
Yeah.
Dude, we might be able to crush this out if you want to make your phone call.
Yeah, I think it'll be fine.
Okay. We'll just hold off and wait for him. Dude, this is fun.
Yeah, it's everyone. Thanks for doing that, Jen.
Of course, man. Yeah, this is. I'm interested in the vestibular thing.
Yes, like I know you can't before doing everything.
Well, I'd say that's pretty separate from everything else I've seen here.
Yeah.
Your head doesn't want to extend or rotate. You don't want to
Yeah.
go back and left at all.
for sure.
So I can kind of I'll show you just like the theoretics behind the vestibular testing. So there we go. Oh, that's auditory motor. Vestibular. What is vestibular? Human auditory motor system. Focus, middle ear. Well, whatever. I could just give you the. There we go. Like inner ear GPS system.
Mm-hmm.
So let's see where it's just nice to hear hit like the actual hypothesis behind why we're doing this. Premise. Okay, biomotor control is broadly based on the physiological mechanisms of sensory motor integration and the interacting neuronal projections and pathways contributing to system motor expression. Presence or absence of efferent or afferent information along with the local electrical conditions of relevant neuronal pools influence motor unit firing frequencies and recruitment. Here we go. Hypothesis. Vestibular motor system influences cervical and peripheral motor control. This influence can be assessed by changing the head and body positions to bias the vestibular apparatus across specified head and neck and body postures. If a vestibular information processing limitation exists, it can be detected via the cervical motor or other peripheral motor systems regions via QMAMC of cervical trunk and spine and peripheral motor control. This is due to projections of nerves serving the central nervous system and synapsing via interneurons. With motor and sensory nerves via the caudal pontine reticular nucleus of the cervical muscles, like the traps and SCM. These muscles may be innervated by motor and sensory pools generated in the vestibular system, can alter the polarity of other sensory motor neurons, like your neck muscles, in the cranial and spinal. Cranial and spinal nerve columns, thus affecting their electrical fields and depolarizing thresholds. So short-circuiting motor pattern there. This may lead to changes in firing frequencies and motor unit recruitment of other neuronal pools, resulting in reduced gross motor output and torque production to specified muscle groups for a specified configuration. So if your brain doesn't trust your vestibular system to go back and left, it's not gonna allow the muscles of the neck to take you back there.
Yeah.
Which it could be a range of motion issue too, but just based on what I was seeing with your eyes going that way, it looked more than just a mechanical limitation there. So that's why I was kind of interested in that.
Yeah, it is interesting. What's more? I feel like I'm putting in context of what I do.
Backbending.
I go left side backbending so much easier than right side backbending.
Which way did your head have to rotate when you go right side?
Exactly, right?
If your head's rotating right.
Exactly. I never.
Yeah.
Here.
So your eyes are already doing the thing again.
Yeah,
I just watched
here.
them. Your eyes are starting to bug. Yeah, Eli, watch this. So watch how natural this looks in his body doing that. Watch. Look, you see that like flicker and is going they start tacking?
Yeah.
Yeah, you see they're tacking right now.
Yeah.
He's like trying to find
I'm
a
searching
space.
for something.
Yeah.
Yeah.
So
I think it's like related to. Yeah.
What-
Is it
related to
the rotation to the
for
rib
sure,
and
right?
stuff,
So
right?
there may be a vestibular role in your rotary issues that you're having. So your body may like. Do you remember playing Halo?
Yep.
Okay, remember when we calibrated Master Chief in the beginning of the game, where
I
like,
got like
right when you would like
calibration got
do
fucked
that,
up.
do that, and that, so you would calibrate the stick and like
Yeah.
you would learn how to do. So like sometimes the stick would like it would get sticky and it would
Yeah.
be doing this.
Yep.
Right.
Yeah.
Your brain is doing this. It's saying don't go here.
Yeah.
So its neutral set point position is getting away from left
Yep.
rotation.
Yeah.
Which is
right
weird.
rotation.
No. Your head doesn't want to go back and left, which is really interesting.
Oh no, yeah. No, I see
So
what-
I'm
You're
curious.
saying head.
Yeah, so now
I'll say
I'm
rib.
curious. Your body is rotated left when we assess you.
Yeah, exactly. That's what I was saying. I was
No,
saying
yeah,
I have
yeah.
a rotation left, which means my head
It
has
is
to-
rotated right.
Yeah, all
So
the time.
now the question is it a
Is it-
body rotation right issue, or is it a head rotation vestibular apparatus system left rotation
Yeah.
and back issue? So these could be two very related issues. The vestibular screen.
Yeah.
That would be cool to dive into that. Okay. That's cool stuff. That's why it's good that, you know, when you have
Yeah.
the capacity to assess somebody fully. I mean, that's something we wouldn't have seen if we were cherry picking today.
Mhm.
There's no chance we would have seen that. Okay. Cool. Prone. Here we go. Okay. It's gonna be a fun one to process, dude. It's gonna be meaty. Yeah. Okay, so I'm gonna have you go knee bent, and
Just a
then
sec.
yeah, and then just hip extension there, and then back down. How much are you pressing with that right leg?
Quite a bit.
Okay.
Want me not?
Yeah, let me just. I'll just kind of give you a feel of deload here. You don't have to. You don't have to lift up, but yeah, go for it. And then down. Nice. How'd that feel?
Almost like I had to potentiate.
Yep.
Like
I dig it.
I couldn't access it immediately.
It almost looked like it got good though for a second. Like it got.
Well, what
better.
it felt like is like like this was sticky, and then I was able to like
Find
unstick
it?
it almost.
Okay.
Yeah.
Like almost
Yeah.
like just getting away from the comp pattern helped you.
Yeah.
Yeah, it looks good. Does that feel good to do that?
Yeah. Yeah. Feels correct.
Yeah, let's start that and just write like, it's just, yeah, I mean left. And we'll give it let's give it a 2, and then the CM was R hip flex. And I would just, yeah, on the notes, just write feels good. And then just draw an arrow to that left one because it's the left side that feels good. Yeah, nice. And then let's do this one. And then lift. And rest. How'd that feel?
Pretty good. I'm gonna try it without left flexion.
It seems easier.
Yeah.
Like you weren't really hammering this like you were the other side.
Yeah.
Okay. And then yeah, you started that.
Yep.
Cool. Okay. Yeah.
We're
Why
just
not?
line for here. We're going.
Yeah. Let's just go. What's that one say? Internal.
Yeah. Hip internal
Okay,
rotation.
bend this, and then internally rotate the hip. Yeah, okay. You want to go further? I'm just kind of blocking you out because it feels like you're getting comped already.
No, I don't know. Yeah, I can't.
That's
I mean,
it.
It feels like I've run out of room.
Yeah. Okay, and then go here. It's massive.
Yeah.
Yeah, 1.
That was right.
Yeah, right 1 P. Block. Yeah, and this is the rationale, like for his system, because he's got such a, I mean, we're really nitpicking with him
Mhm.
because he's got so much available stuff
Yeah.
that like finding the little the needle in the haystack. That's why it's worth going through the whole
Mhm.
thing with him.
Mm-hmm.
So,
Okay, now we're external.
yeah, there we go again. And I mean, you might, when because we have time today, there's rationale here. But, and then go here. Ooh, that feels a little less great
Oh, yeah.
over there. Yeah. So left, go here again. Yeah, let's go like left, 2.
It's quite a bit different.
Yeah. It feels better than the internal. That don't feel great. Let's go 1. That also does, he's like hip flexing to get there. Do you
Yep.
feel that?
Yeah, yep. That's what it feels like.
Yeah, go a comp pattern hip flex. Dude, this is gonna get you locked in with like making notes here.
Yeah, I'm getting
Yeah.
already so much better.
Yep. And then let's go with 1, and then let's go with a F on the motion quality. Cool. What's next? Is that P flex stuff?
Yeah.
Okay. Point the foot in, and then point the foot up. Cool. Rest. Point the foot out. Point the foot up. Okay. Let's check this side. Point the foot in and up. I don't like that. Okay.
That was a lot. That's
Yeah, that's left. Let's give that a 1.
That is. Let's see here. What's that? Adducted.
That's adducted. Yep. And that's left 1 P. Yep. No comp stuff. Just doesn't know how to do it. And then go out and then up and rest. Do that again. I don't like that either. How's that, Trev? How does that feel to you, man?
No, I
It's
don't
just
perceive
weird.
anything different.
Okay. Just doing weird. Go this way and then go up. Okay. And then go out and then go up. Like bending his knee and doing all sorts of weird stuff. Bend this knee. Drop down. Put it in and up. And then out and up. Yeah, both of them on that left side don't feel great to me. But can you not really sense that?
No, I have no perception.
Yeah. Okay.
What do you want to number that?
Let's go to
Any motion quality you want to say about it?
F. Yeah, it's fair. It's not horrible. It's just weird.
Okay, full spinal rotation, neutral, capital.
Okay, so that's we'll test that on the total, Jim,
Oh yeah.
and then we'll go lateral flexion. Is that upper first?
Yeah.
Okay. So I'm gonna have you we'll go arms to your sides, and then you're just gonna extend up a bit. Arch
with
up.
what?
T-spine.
T-spine?
Yep. And then side bend right. Perfect. Come back. Side bend left. Okay, cool. How'd that feel?
Good.
Side bend this way.
This side doesn't feel good.
Okay.
It's like
Stuck.
it's the same. I think I was saying on when we were doing the lateral flexion stuff. Like I can go.
Yeah.
It just doesn't feel.
You know what it
good.
looks like to me? Is it looks like this stuff gets closed out too soon. Like you don't have anterior compression to keep that open on that right side. I might be wrong though. Did you do both?
I'm not sure.
That's not it either. Okay.
No.
We might need to look at this on the total, Jim, to get him out
Don't
of.
even bother with anything on
No, don't. Yeah. And then let's go legs together if you can. Yeah. And then I'm gonna have you slide your legs right. And then come back and slide them left. And come back and slide them right. Okay, that right is not great. Yeah, let's go a 1
Yeah.
P. And then that's it. Yeah, it just doesn't look like he wants to move. Okay, and then GH.
Yeah. Humerus extended.
Okay, and then on that upper side bend, just write TOT next to it. Yeah, just in that space there. Yeah, perfect. Thanks. And then what's the next one?
Yeah. Humerus extended, elbow flex 90. Humerus internal rotation.
Yeah. Okay, so we're going here, just one side at a time, and then internal rotation.
Yeah.
Okay, so we're gonna just drop this elbow down to the floor. How's that feel?
Not great.
Okay.
And then glenohumeral.
Yeah, let's go 1 P. And yeah, not great. And then check that red box and just write GH. Is it anterior GH that doesn't feel great, or just in general?
More anterior.
Yeah. So you could just write A and T GH, or GH A and T is fine. And then go here, same thing.
Yeah, fine.
Just noodle, yeah. And then left is great there, and then we'll go external, same thing. You can just do the same one again here. So same hand, yeah, and then we're gonna go this way.
Okay.
And come back down, so that's retraction. Just try doing that GH motion.
Oh, okay.
Yeah, rest, so you feel all that whole scap's moving here.
I don't
Come
have
back
a lot there.
Go again. Yeah. Okay. Yep. And then same
I'm not
here.
sure if I'm gonna have any here.
Okay, no.
So both?
Yeah, I mean, this right side is a 1. There's nothing here. Your infraspinatus is not doing shit there.
Yeah.
So right was a 1.
I'm not even sure what I'm supposed to do there.
Do this side again. You can feel it here. That. Yeah.
Yeah.
There it is.
Okay.
There it is. 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 Yeah. 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 Ooh.
Yeah.
Let's start that one.
It's so hard to coordinate.
Yeah. I know I have to I'm like putting my
Yeah,
body
yeah,
in your scalp, dude. Okay.
You want, so we don't want me to put that.
Yeah, I mean let's say that the right is definitely the big dog, but maybe just do like a teeny little circle on the L. Yeah.
Cool.
And that's fine. Yep.
Sweet.
Okay, then we have GH extension. Next.
Just straight up.
Is the first one
Yeah.
supinated?
Yeah.
Go palm down and then extend up. Oh, I'm sorry, one at a time there.
Oh.
Yep. Okay, cool. And then same here, supinated. Oh, wait, let's reset there. Yeah, and then extend up. Those look about the same to me. Trev, how do they feel to you?
I think like my perception is the right took more effort,
Okay.
but yeah.
Let's give it a 3. G. And then just try more effort on the right side. Yeah, cool. And then go pronated. Yep. And then same thing here. I just want to.
Jesus.
Yeah, your brain gets kind of noodly when you start doing this arm stuff, huh?
Yeah.
And rest. I felt that looked pretty good. How'd that feel, man?
That's fine.
Just effortful.
Yeah.
And then same here. Oh shit. Okay. Wait. Okay, now let's do them both. Dude, those are pretty damn good. Is this just more effort?
On that one, not even really.
That didn't look like
In the
supinated was harder
it was definitely harder.
with the external rotation. Now, those look pretty good, man.
Clear.
Yeah, let's. What do you think, Trev? Clear?
Yeah.
Let's clear them out.
Let's
Yep.
I gotta get going.
Okay.
On that one, but sweet. Nicely.
Bro.
Yeah, that was sweet.
Yep.
Thanks, Trevor.
We got the
Thank
video.
Thank you,
so
dude. This is fun.
Yeah.
Okay. Okay.
Let you guys finish it up.
Yeah,
I'll
man.
watch the video, catch you up.
Yep. Yeah. We just all we have is spine left, and then
Sweet.
we're good to go, dude.
Cool.
Have a
Alright,
good
see you
rest
guys.
of your day,
Yeah.
man. Thanks for coming in. Okay. Shall we? How you doing, dude?
We'll see him up there later.
Yeah, exactly. I'm like, what up, fam?
What's up, dude? What's up?
Okay, we're going elbow extended, radial or neutral, full GH adduction. Oh, did we get neutral there? Yeah, okay, and then we're doing full GH adduction. So we're going to go neutral arm position. So there, and then we're going to go into GH extension. Yeah, nice. And then we're going to adduct. Okay.
So it has a weird feeling.
What are you feeling there? Is it pinchy or is it just
No.
it's just not used to
just-
doing it?
just-
Blocked?
Yeah, but it's like a muscular block.
Okay.
Just
Not like a
what-
wally thing.
Uh,
This would be kind of the feeling here. It's this like
uh,
closing. Yeah,
I
like
see.
latty closing. There you go.
it is.
Yep.
Yeah, now I'm starting to cramp.
Yeah, nice.
Yeah. Yep.
Okay, and let's check this side. Neutral. Yep, and then extend, and then adduct. What's that feeling like, man?
Yeah, just like again searching for.
Do you sense that you can't keep your elbow extended?
Oh,
There you go. Oh, look at that wrist flexing too.
yeah.
So hard, definitely harder on that side.
Yeah.
Okay. We're gonna go. That's right. Let's do that one. Comp. Wrist. Flex. Slash elbow. Yeah, it's interesting. Elbow. Flex. You like want to go. Your whole system wants to like flex to
Yeah.
get there on that
Yeah,
right
yeah.
side. Whereas
Yeah,
this
yeah.
side, it seemed like you could pretty much keep pretty adequate elbow extension there.
Yeah.
Yeah, okay. So, got cervical full extended, full cervical rotation. So I'm gonna have you just lift your head up as high as you can. Yep, and then rotate one way. Cool. And then come back, and then rotate the other way. How'd that feel?
Yeah, left is
The thing
more
again.
challenging.
Yeah. I was kind of wondering which way you were gonna choose to go first, too.
Oh yeah, of course.
Left. Dude, I'm excited about this vestibular thing. Cervical full extended, full cervical rotation, left, 2, fair, okay. And then we have capital fully extended, full capital rotation. So we're just gonna, we're just gonna go chin up, and then rotate. Yep.
Just chin up.
Yep. And then rotate. Yeah, you can go right. Cool. And then go left. You want me to drop that face cradle down a little bit, or I can just. Yeah, there we go. Ooh, that's kind of interesting. Dude, how does that feel?
Not so bad.
I know.
Yeah. Not as bad as I was expecting it to feel.
No doubt.
But it's when I go into more cervical.
Cervical, I agree.
Yeah.
That's interesting.
Not capital.
That be. Let's see, capital is going to be more connected to your eyeballs. Okay.
Actually, yeah, now that you say it, like, my eyes didn't do anything.
Yeah, I know, I was noticing that. It would be really interesting to just feel this going into extension with your eyes closed.
Should we do it?
Yeah.
So
eyes closed and then lift your head up.
full
And- yep.
extension?
And then rotate left. Do you get any kind of nauseous, sicky feelings there? No.
No.
Okay, cool. That's kind of cool to see that though. Huh. Well, it might be an ocular thing then. Okay, and then we have retraction is the last one that we're doing prone here. So I'm gonna have you retract. Yeah, just one at a time here. Yep. And then back down. And then retract. And then back down. Cool. How'd that feel?
Good.
And the same thing here. Retract. And back down. Damn, that looks pretty good. Retract. And back down. How's that feel?
Good.
Those look fine. Are you seeing any or feeling anything different there?
No, I think though, in that setting, my protraction feels okay. Elsewhere, it might feel different.
Like in a loaded configuration or
Yeah.
okay.
Yeah.
Do this one again. And then back down. Do that other one. It looks like the muscles are like activating differently, but the range itself looks pretty good. Is that
Okay.
kind of what you're feeling?
Yeah.
Okay. Okay, we're gonna go total gym. Yank this thing charged up. Ooh, there it goes. Okay. How you feeling, man?
I feel good. Yeah, I'm interested in this. I have no idea what I'm doing on this. Oh, I think I see what we're doing.
Yeah.
Alright, sweet.
Yeah, so
That's sweet.
what I've seen on the table, and this is kind of like one of the reasons we have the total gym, is to decrease the gravity influence on the body.
Mm-hmm. Yep.
So we're just gonna look at rotation here. And then I do want to look at that lateral flexion of the spine too. So
Yeah.
we're gonna go here, rotate, here, rotate. Oh, I don't feel good. And then lateral flexion,
This is it right here.
lateral flexion.
This is like where I perceive the most.
It's gonna be
difference.
blown up,
Yeah,
okay.
Yep.
Just make sure.
Where do you want this making contact?
Kind of like pelvic, like high pelvic region there.
Yeah.
Awesome. That's great.
Like cranking extension,
Oh,
just
still
like a
going.
normal
Nice.
amount of extension.
Yeah, just kind of good feelings of extension. Yep, there we go. And then I'm gonna have you rotate. Cool. And then come back. How'd that feel?
It's not great.
Okay. And then rotate left. Huh. Those are interesting. Come back. Rotate right again. What's weird is it actually looks like you're getting more true rotation right. Come back again. And rotate left. Like it looks like you want to start falling laterally to the right. Like like your spine. Yeah, I'll get this so you can. Oh, it paused it. Gosh darn it. That sucks.
We can do it over.
Yeah.